All right. Thank you. Good. All right. Morning. Welcome to today's session. I hope you all had a good rest after yesterday's wonderful presentations and the speeches that we had. Today's session is about fostering a culture for evidence-informed decision-making in Uganda, and our panelists are already here. It is a fireside session, so the audience will participate, but mostly it's going to be a conversation. In our African culture, as you heard from Adeline, I think yesterday, mentioned something about it, about her grandmother, putting them around the fireplace to tell conversations. So we're going to have a conversation between practitioners in government and also an evidence intermediary, talking about how they've tried to foster a culture of evidence-informed decision-making. Please welcome our panelists and our moderator. I'm going to hand over to our moderator, Dr. Kasiliye Ibrahim from the APRSC at Makerere University. Thank you.
Thank you very much, Ismail. Good morning, ladies and gentlemen. I wish to welcome you to session 7 of this conference. At this juncture, I wish to invite our panelists. First, Mr. Vincent Tumusime, who is the Director of Socioeconomic Monitoring and Research at the Office of the President. Then Madame Josephine Watera, who is the Assistant Director of Research Services at the Parliament of Uganda. And then finally, Mr. Edward Kayongo from ECAS. I will briefly introduce them. The first panelist, Mr. Vincent Tumusime, is working for the Office of the President as the Director of Socioeconomic Monitoring, and is in charge of a very unique institution or secretariat called the Secretariat for Public Policy Execution Oversight Forum, codenamed the Apex Platform. So he will be talking to us regarding that this morning. Madame Josephine Watera is the Assistant Director in the Department of Research Services in the Parliament of Uganda. She's worked there for a considerable duration. She's also a member of the Uganda Evaluation Association, and parts of which she will talk about this morning. And then we have from our very own Edward Kayongo, who will be talking about evidence intermediaries. To kickstart us off, we all know, as was indicated in some of the sessions yesterday, that evidence-informed decision-making is important, partly because in a number of African countries, decisions are not guided by evidence, but in some instances are guided by political factors, and political factors change quite dramatically from time to time. Nonetheless, quite a lot of people are left out if decisions are not guided by evidence, and some of the people left out are the most vulnerable. So this morning, we have a session that's going to look at how specifically government institutions use evidence and how the non-government institutions, evidence intermediaries, also use the various strategies and capacities to promote evidence use. I will start with Mr. Vincent Tumusime. In 3 minutes, could you explain to us how the Apex platform is used to guide evidence decision-making within the Office of the President, as well as the wider government policies and programs? Thank you. you will need to use your mic, please.
Thank you, moderator. Good morning, participants. I've already been introduced, and I've been given 3 minutes to explain what I do in the Office of the President, specifically through the Apex platform. Apex platform, as the moderator has already indicated, is a high-level public policy management forum. And it's one of the key reforms that was introduced in NDP 3 for effective implementation of government policies. So what we do is we try in as much as possible to gather information from various stakeholders, including the beneficiaries and institutions that have been implementing, say, policy or program or project, and over a period of time, say 5 years and above. So what we do, we try to trace how that policy has been effective or ineffective, and try to identify what has been achieved and what has not been achieved by gathering information through primary data, secondary data, and then also doing a thesis of various reports that other key stakeholders come up together, right from the implementing institutions, the civil society, the independent researchers, and even just press, world views, and then we gather them together with insights. We come up with reports which we subject to validation by various stakeholders. Then we present them to what we call a pre-apex, where we bring all key stakeholders to come and validate the kind of information that we have come up with, and then we use what we have come up with to make actionable recommendations, which are then subjected to another panel called the steering committee, chaired by the head of public service, and then from there we come up with concrete recommendations that we think could change policy or influence policy, and then we take them to cabinet, and cabinet pronounces itself on either policy reviews or dropping policies or advocating for new policies. Basically, that's all we do. Thank you.
Thank you very much, Mr. Tumusime, for that brief about Apex. I'll come back to you. Josephine, from the vantage point of the Parliament of Uganda, as well as your other engagement with the Uganda Economic Association, could you please, in 3 minutes as well, explain the extent to which the Parliament of Uganda is guided by evidence-informed decision-making?
Thank you very much, and good morning. Parliament has different structures that facilitate the generation, translation, and use of evidence processes. So besides the research department that I'm going to talk about a bit more, there is also the Parliamentary Budget Office that gives evidence that relates to the national budget and its expenditure. There is the Office of the Legal Department that provides legal kind of evidence, because we also go with evidence-based legislation processes. And then there is the Leader of Opposition's Office and Leader of Government Business. By the way they sound, they produce evidence that is biased to those offices that they're in. The research department will be celebrating 25 years next year, and we offer independent advice and evidence-based information to committees and individual members of parliament in form of policy briefs, in forms of position papers, in forms of field-based reports. So we undertake primary research on specific issues of concern, and this can be proactive or on request by the committees of parliament. And we also do policy briefs and bill analysis. So when a bill is introduced in parliament by the executive, we undertake a detailed bill analysis to ensure that this is well informed. And what are the other aspects that we've opened up so that we can work with others and facilitate this process better? So we have a partnership with the UBOS, Uganda Bureau of Statistics, that provides us statistical data when need arises. We also work closely with the EPRC, where ISMA is based, to get independent assessments that come from outside. We work with ECAS for rapid assessment on issues that emerge also for committees. They have been very instrumental during the COVID times. And we have other partnerships also with, like also the NURU, is the National Union of Research in Uganda. On the side of Uganda Evaluation Association, so I'm wearing two hats today. They facilitate the process of capacity building. So the staff of the department are institutional members of the Uganda Evaluation Association, and so they facilitate the learning from that side. But also when we have the Uganda Evaluation Week, for example, we usually have parliament and members of parliament come to talk about what they do there. Lastly, I'll just mention in 1 minute now, we have the UPNOD Uganda chapter, the Africa Parliamentary Network on Development Evaluation. So I've talked about the technical side, but this is the political side that advocates for use of evidence. It involves members of parliament, and in a way it's also to raise momentum for them to appreciate why evidence is important in their work. Thank you.
Thank you very much, Josephine. Edward, what is ECAS and how does ECAS perform the functions of an evidence intermediary?
Thank you very much. So my name is Kayongo Edward, and I'm a senior research scientist at the Center for Rapid Evidence Synthesis. For those of you who are not from Uganda, welcome to Uganda. I hope you're enjoying your stay. This is the Pearl of Africa. So when you go back home, just be sure to mention you are in the Pearl. It's really beautiful. So about the session, so ECAS is basically a group of individuals who are so much interested in evidence and the use of evidence to inform policies and decisions, not only within Uganda, but within the region and Africa at large. So basically what we do is twofold. So we play the role of knowledge intermediaries or knowledge brokers, but we also undertake primary research when it comes to evidence-informed decision-making. I'm going to talk about that too, independent of each other. So as a knowledge intermediaries, basically we look for the evidence wherever it is, package it in such a manner that we make the information available to the policymakers and supply this information to the policymakers who end up using it to inform the policies and decisions. So we use the rapid response mechanism in getting this evidence into the policy space. Basically, the rapid response mechanism ensures that we get timely, relevant, and contextualized evidence to support the urgent need of evidence, and we define urgent as a decision that is going to be taken within 28 days. Within means it can be from 0 days to 28 days. So maybe something to note here is that that decision is going to be made within 28 days and not necessarily that the evidence is needed within 28 days. Where the difference comes in is that a policymaker can come to you, they tell you they need the evidence within 2 weeks, but the actual policy that is going to inform is going to be within 2 months or 3 months. So the policymaker has this perceived urgency for need of the evidence, but in reality, it is not really urgent need. So in that case, we usually refer the policymakers to some other groups that provide the evidence within, longer than 28 days. So our major interest is that we have limited resources and we should be able to meet these urgent needs where the decision is within 28 days. So that is basically what we do on that end. Some of the products we produce include the rapid response briefs, we have citizen briefs, we have policy briefs. Now, for the policy briefs, it's usually longer than 28 days. It's difficult to produce a policy brief within 28 days because here you're going to provide evidence that spans across the entire policy question, from what the problem is, from the available options for solving this problem, and then you also have to provide possible implementation strategies for the different options and also provide the cost effectiveness analysis. But for the rapid response brief, it is usually a very targeted question. A question could probably be focused on understanding what the problem is or understanding the different available options for intervening in a particular problem or ways of implementing a particular option that has already been chosen by the policymaker. Sometimes, though rarely, we get questions on cost effectiveness. Usually our cost effectiveness comes in the broader policy briefs, not in the rapid response briefs. Then on the side of primary research, ECAS usually tries to be at the forefront of innovations when it comes to evidence-informed decision-making. So in this, we always try to understand how better can we provide the kind of service that we provide to the policymakers. So we keep exploring, trying to understand the policymakers' needs, trying to understand how better we can package this information, how better can we build trust between the knowledge intermediaries and the policymakers. Because at the end of the day, our relationship with the policymakers is based on trust. They have to be able to trust that you're going to provide evidence that is relevant to their policy process, but also unbiased evidence, and you are in position to deliver the evidence as and when it is needed. Otherwise, if you fail them on that front, chances are high the policymakers will always regress back to what they used to do without you. Because either way, whether you're around or not, the policies will have to be made. Whether they're informed by evidence or not, the policies will be passed. So you have to make yourself relevant, build that trust. So there is always that ongoing research from our end to try and understand some of these aspects. Packaging of the evidence is really important. Different policymakers need the evidence packaged differently. It is not always the same thing. You need to be able to come up with innovative ways in which you can package this evidence. So you always have to keep thinking, planning, think more like a primary researcher, but also think more like an evidence synthesis specialist at the same time. Okay. So in a nutshell, that is really what ECAS is.
Thank you very much, Edward, for that brief regarding ECAS. I'll go back to Vincent. How can the government support evidence-informed decision-making within its structures and processes, either within the Office of the President, but also outside the Office of the President for the departments and agencies for which you provide oversight?
Yeah, thank you. I think the government of Uganda has supported that because of, mere approving, for instance, the Apex platform, an institution that brings together institutions of government that are at the center of program or policy project conceptualization, planning and budgeting, implementation, and then also the office that is in charge of implementation. Then again, creating a platform to synthesize all the evaluations that have taken place from different aspects to try and understand how an intervention has been effective or not. To me, I think that's one way of supporting the culture of evidence. But another one is also encouraging collaborations. Encouraging collaborations between the state and non-state actors to be able to utilize the findings of the non-state actors and then use them to inform or guide government policies. I see that that one is also another way of supporting the culture of use of evidence. Basically that.
Okay. Thank you very much. To Josephine, how can researchers or other interested parties take advantage of the available pathways to engage with and support evidence decision-making processes?
Okay, thank you very much. I will start with what happens within Parliament, and then I'll cross again to Uganda Evaluation Association. So within Parliament, whenever Parliament is going to sit, we have what we call the order paper, which will be like agenda, but in terms of Parliament language, it's called the order paper. And this order paper is made open, it's accessible by the public on the website before the sitting of Parliament. Actually, the rules of Parliament now provide that the order paper for the week that follows is prepared a week before. So today is Thursday. By close of day tomorrow, we should be able to have the order paper of what business is going to happen in Parliament next week. So this gives our evidence generators and producers an opportunity and a kind of a roadmap to know what business is coming in the House and therefore what they need to do about this. So that is what happens in plenary in terms of the debates and the preparations for plenary. And we have another avenue in forms of committee system. So all our committees are open. We operate an open committee system for purposes of drawing in citizen evidence and also research evidence that comes from institutions. Like I mentioned, one here is the ECAS itself. We work so closely with them. And the committee, when we're having, for example, a bill before Parliament, they usually run in the newspapers an advert calling on anyone interested party or key stakeholders, primary and secondary stakeholders in this bill. If it's an issue of land, if it's an issue of, let's say, road safety, if it's an issue of environment, education, health, there are key players in this area who have already, specialized. So they'll reach out to the public generally in the newspapers, but also the committee will write, targeted invitations to stakeholders in civil society organizations and research bodies to come and give feedback on this bill that is before Parliament. So it's also another way of opening up for them to come and participate. The last one is about petitions. So the public has the open platform for petitioning when there is an issue that is happening and they think that Parliament is not moving fast. They can bring a petition through the office of the Speaker, and this petition is fast-tracked, and it will usually summon the side of the executive to show cause on what actions are being taken and what needs to be done in terms of hearing also from the petitioners on the issues that emerge. Let me just mention that in Uganda we have the whistleblowers law, and so in a way it also provides an avenue of people who want to remain anonymous to provide information in Parliament, and they are protected. So when people bring information and they prefer being anonymous under the Whistleblowers Act, nobody's going to victimize them and come after them. Let me mention also the last one now on the side of Uganda Evaluation Association. We've worked closely with the Office of the Prime Minister, setting up the mapping of practitioners and evaluation professionals in the country so that we get to know who is where in terms of skill base. And then we work also together at the end of the month. Every last Thursday of the month, we have the National Evaluation Talks, and we bring people with different methodologies to come and share their experiences with members of the association, and it's open, even others, so that we get to know what is happening out there, and in a way we grow together. Thank you.
Edward, how can knowledge brokers like yourselves position themselves better to engage with and support decision-making processes? She's already mentioned you are working with the Parliament of Uganda, but how can you better engage with institutions beyond Parliament as well as Parliament?
Thank you very much for that question. And I should say it is one of the things that we constantly ponder over and keep thinking about how better to do this. But currently, the strategy we are using at ACAS is building relationships and trust. Yesterday, we had a lengthy discussion about relationships. But at the end of it all, what is really most important is for the policymakers to know that they can trust you to provide unbiased evidence, so that they can trust you to provide that evidence when it is needed. So how do we go about this? One of the basic things we do is inviting policymakers to attend conferences like this one. We have several policymakers who are attending Evidence 2023. Then we also invite policymakers for breakfast meetings. These are usually short meetings, probably like 2-3 hours, where we talk to the policymakers, tell them about what ACAS is, what ACAS does, what kind of service we can offer to them. Maybe something I hadn't mentioned, ACAS uses a demand-driven strategy. We rarely do horizon scoping. We usually prefer for the policymakers to come to us with policy questions, because that way we are almost sure that the evidence we are going to provide is going to be used to inform a policy or a decision, versus if you push the evidence to the policymakers, you are external to the process, you're just coming in with your evidence, which they didn't ask for, so it might not be used. So in all the efforts we undertake is to try and show the policymakers how to identify questions that need evidence, because literally speaking, all policy processes require evidence. But how would you get the policymaker to appreciate that they need evidence? And how are you going to get them to appreciate that there is a difference between a primary producer of evidence, a difference between a content expert and a KT practitioner, a knowledge translation practitioner? You need to be able to get the policymakers to that understanding of all those differences, because some of the policymakers have experts, they have numbers of content experts. So if they're talking about cancer, they'll pick up a phone call in Parliament, call someone within the cancer department at Makero, within Mulago National Referral Hospital. They get evidence. Such evidence from an expert is usually biased with the expert's opinions and lived experiences. So you need to get the policymakers to trust you. I think the key thing here is relationships and trust. The ways in which you're going to build the relationships is what is going to differ. The other strategy you use for building relationships is using evidence champions among the policymakers. So you'll find that you have a policymaker you've worked with for probably the last 1 to 3 years. So you're going to work through that particular policymaker who is already converted to believe in evidence and evidence-informed decision-making, to introduce you to his other colleagues. That way you get a more soft landing compared to if you come out of the blue and you're trying to set up meetings. Sometimes it will be a little bit hard. Then we also use policymakers during our breakfast meetings and dissemination workshops to talk about their lived experiences working with us, to fellow policymakers. So here you have someone from the policymakers' end talking about you to fellow policymakers. So in one way or another, it further builds the trust among the policymakers you haven't worked with previously, to know that you actually provide a service that is good because it is one of them talking on your behalf. Then the other strategy that we rarely use, but sometimes we go to it, is trying to use the top-bottom kind of approach. If you know a minister, a permanent secretary, sometimes you work through them to get the different departments to push questions towards ACAS. The challenge with that is that many times, if you use that kind of approach, the people within the policy analysis units or the commissioners and the like, they might ask the questions simply because their permanent secretary has instructed them to use the service you're offering. It does not necessarily mean that they will be able to use the evidence. So that is an approach that is still a little bit shaky, something that we need to further think about and modify, but it is also one of the easiest ways to use, but at the end of it all, I think it is relationships and trust that would push the use of evidence further within governments and ministries. The very basic example is our work with Vincent and Josephine. So with Vincent, we've worked with him for 3 years now. Yeah, so we've worked with Vincent for like 3 years now. We've participated in different reports that have gone to the Apex platform. So right now I can comfortably say that Vincent trusts the kind of work that we do. His unit is already sending questions to ACAS, and we are sure that evidence is being used because we've attended some validation meetings within Apex. Josephine also keeps talking to us and asking us for evidence. That relationship is built on trust. So that is what I can say. Thank you.
Thank you very much. Just to take you back, so what happens when policymakers don't demand for this evidence?
Very good question. So we've had a few scenarios. So I'll give an example of COVID-19 global pandemic. So at the beginning of COVID-19 global pandemic, as ACAS, we felt like we had a big role to play in shaping the direction the country was going to take in addressing the global pandemic. However, in the first, let's say, 1 to 3 months of COVID getting to the country, because I think we recorded our first case of COVID around March 2020. So there was a panic, like in most of the other countries globally. So government rushed into lockdowns and the different things that were done to try and control the pandemic, COVID from spreading within the country. I can't really say it was the best strategy or not, but we were left out of the initial stages of the decision-making process. So it was now up to us to tap into our connections within the Ministry of Health to try and push the people who are at the decision-making table to come and request for the evidence from us. So we worked through evidence champions. We worked through one of our directors, Professor Nelson Sewankambo and Dr. Rona, who have deep roots within the Ministry of Health. We had one of the professors at School of Public Health who was on the committee that was directly reporting to the president. So we had to look for those particular individuals who could approach and tell them, you know what, we are still available, we can still offer that service. We also had to work through some commissioners that we had previously worked on other questions, and they were not directly involved in the response to COVID-19, but they could get the evidence to the decision-making table. So at the end of it all, you try your level best to ensure that you have constant demand. And as I said, at ACAS, we also have the primary research angle to it. So we keep thinking of innovative ways on how to stimulate this demand and keep the questions flowing, because we still need to support evidence processes, decision-making processes with evidence.
Okay, thank you. Vincent, so many institutions have talked, they are working with the Office of the President, but could you explain to us the funding mechanisms available for the promotion and use of evidence in government policies and programs?
Well, we basically don't provide funding as Office of the President to gather evidence from the partners we work with. For instance, ACAS, we make a request on a topical issue, and they use their own available resources, and they give us the kind of information we use, and then we build on that to push it further to cabinet. But we have also tried to make some bit of networking and collaboration with agencies like UNDP, where we source for funding of some studies, and UNDP has helped us on funding some studies that at least gives us some information to build on as we search for evidence. And but for the ministries, like for instance, the Apex framework is built on the concept of the policy life cycle, we look at the institutions that have been implementing, that have conceptualized the intervention we are trying to examine, and then those that are in charge of planning and financing and those in implementation. So those institutions, we require them to use their resources, but in some cases, we also complement specific studies within institutions which are targeting a certain topic that we are looking at, and once that one is produced, it becomes now a collective document that we sponsor. But basically, the funding mechanism we use in Apex is basically through networking and collaborations with institutions that can fund their own studies and those that we can co-fund partly for specific studies, not for every work we do. Thank you.
Thank you very much, Vincent. To Josephine, what are some of the different strategies available to strengthen the governance structures that can support systems for evidence-informed decision-making?
Okay, thank you so much. And I'll speak broadly because I am in the government, circle, in the broad approach that the government has taken. I will start with the national M&D policy. And so this sets a path or a framework upon which we are setting up evidence, both on the side of the data itself, but also the personalities, the resources, the persons, and the data. And then I'll go to the National Technical Working Group, the National M&D Technical Working Group. This is like a gatekeeper. They undertake peer review of evidence pieces in forms of evaluation reports that government has produced. And before this gets into cabinet, the National M&D Technical Working Group does the kind of sieving. So whether this has been undertaken by an independent evaluator or by an institution, this technical working group supports this process of repackaging and refocusing the findings so that they can be used better by the cabinet, where I'm also a member. I will also talk about the government annual performance report. So it's a whole of government approach to performance assessment, and it's also evidence-based on how different sectors in the country are performing, and also the findings that come from here get through cabinet, and it's a very influential process. They're actually having their meeting yesterday and today that informs the next budgeting and planning for the government. I will also talk about the Civil Service College. It is in charge of capacity building, so this is also another strategy that the government has undertaken. It's in charge of capacity building for the M&D cadre. And recently, in the month of April, the Public Service approved operationalization of the scheme of service for the M&E cadre. So this is going to help us to put in place the relevant personalities and specialities of individuals to facilitate evidence use in the country. Within the Parliament of Uganda, like I said, we have members who are already in the association of the Uganda Evaluation Association, but also our team is highly multidisciplinary. So when we have an issue that, just one question that you asked, Vincent, issues of funding, when we have an issue that we think we cannot handle within Parliament, we actually have a small budget, I'm calling it small, to reach out to specialists who can give us, a quick, rapid assessment of a specific issue of concern so that we are not having any gap when need arises for information. Thank you.
Thank you. Before I move to the wider plenary to pose questions to my panelists, Edward, does ECAS mobilize resources to support demand-driven, evidence-informed decision-making exercises?
Okay, thank you. So ECAS runs on grant money mostly for the kind of service we offer. So the reason as to why our service to the policymakers is free not necessarily free because someone is meeting the bills. That's usually the different funding institutions. But the policymakers, the reason as to why our service is free for them, it's because we are trying to build a culture of evidence-informed decision-making within the country. So if you tag a cost to the service, chances are high you're going to deter many of the policymakers from coming to you for the evidence because they don't have the budget for that. You already had Vicent and Josephine talk about the little resources available within their different units. It is the same across the entire government. We do not necessarily have a different docket of money that is set aside for evidence to policy within government. So we try our level best to ensure that we lobby for funds from different sources, mostly through funding institutions. Then we offer the services to the policymakers at no cost.
Okay.
Thank you.
Thank you. I'm now going to open it up to the members in the audience. Anyone who would wish to pose a question to any of our panelists, I'm going to request some help in moving the mic, please. So, first, second, and third.
Thank you very much. Such a great panel and for all the experiences shared. What I would really like to ask, maybe it goes to ACAS. And when you were talking, you talked about having innovative ways of presenting the evidence. So what I really want to ask is, what are those innovative ways? Because I work with a Policy Research Institute, so we basically do what ACAS does. And mostly ways of synthesizing the evidence is usually has to do with maybe policy brief, position papers, like those kind of shorthand notes. So I really want to know other innovative ways that you present your evidence. And then now also we would want to know how rapid is your rapid? Like when you say rapid assessment, what does it really mean to provide like rapid evidence to these policymakers? Thank you very much.
We'll take two more before I ask the panelists to respond. He had his hand up here, and as well as the gentleman in the middle.
Thank you so much. Good morning, everyone, and the fellow panelists. My name is Serge Yakudiam. I'm the co-chair of Eval Indigenous Networks. It's a global movement of indigenous evaluation practice worldwide. So we cover Africa, Asia, and North America with the First Nation in Canada and North America. So a very interesting panel, especially when we have decision makers on the board. And then I really, really enjoyed the discussion, but I want to know one thing. What is the boundary, or not a boundary, but what is the connections has, regarding a country management, you have a little flow of data, flow of information coming in, and then you have to select very specific information or evidence information to take a decisions. Is there within, but I didn't see where you talk about something like knowledge management office, where you get those flows of basket of informations, or let's say databases, where we stock all those data, and then took time to go back and analyze and synthesize and look about the key information you will need to take a decision, especially for Josephine and the chairperson. So how do you manage that? Because it didn't come very clear within our discussions. How do you process and get key information people are looking for to say that you do this, we decide on that? Thank you so much.
Thank you very much. In the middle, right.
Thank you. I'm going to ask a question on behalf of an online participant. Thank you for the opportunity. The question is, where is the evidence published for others to use? That's Joanita Nalunjoki, who is asking as an online participant. Thank you. Where is the evidence published, maybe for others to be able to access? I'm sure mainly to ACAS, I think you are publishing a lot and doing a lot, but maybe where do the people who are interested in following this evidence access them?
There is also a gentleman right in the middle there we've been missing. Yes, please. Please go ahead.
Okay, my name is Remy Ayede. I'm Research and Optic League at the Partnership for African Social and Governance Research, Nairobi. My really concern is, in the many years you have worked with policy communities, how would you say that there has been, or you have catalyzed a change in the culture of the use of evidence in government or any other organization that you have worked with? Because you have talked about, your role, but the ultimate will be to get to a point where government or policymakers are searching for evidence and contacting organizations like yours or ours to help them with solving problems.
Thank you very much. You'll be the last, then.
Yeah, my name is Maxwell Obano. I'm from Ghana, working with an NGO called Tere, based in Bolgatanga in the Upper East region. Was a very informative session. I would like to know how receptive is government when evidence is presented to them. I'm asking this question on the background that there are times governments put up some project in a community and then the people will not use the facility. And so when you have organizations like ICA, my organization, generating evidence and presenting it to government, and then these evidence are in the interest of the people, all right? And then on the other side, you find government implementing projects that are not participated by the citizens. And so how receptive is the government when evidence is presented to them? Thank you.
Thank you. There was a lady here. She will be the final one because I'm mindful of the time and we could have another round if we have time. Please.
Thank you. My name is Gloria Anderson from Tanzania. I just have a very straight question. How is the engagement of the policy beneficiaries, like the citizens or the young people? Where are they being included in the whole process of implementation and the making? That's what I want to know, because recently there has been a lot of fights, especially from my country. The parliament is presenting matters and everybody's like, where is this coming from? A lot of contract policies and all that. So I just want to know from the experience of Uganda, how are you guys engaging them so they don't feel left behind? Thank you.
Thank you very much. I'll go back to my panelists. Several questions were raised. I'll start with Edward. There were several questions posed to you. Please.
Thank you very much for these very good questions. So I'll start with a question on the innovative ways of presenting the evidence. So first and foremost, we do the very basic, the reports. So ours are rapid response briefs. So within the structure of the rapid response brief, it has the first page that has the summary of the key messages that we want to put across to the policymakers. Then after that first page, then inside the rapid response brief, there are all those details in case the policymakers wants to read more. The most important thing is that summary of the first on the first page, because sometimes our policymakers are too busy and they're not going to read a 5-pager. So if you can give them the first page, that is perfect. Then we've also piloted the use of easy-to-read policy profiles. So the easy-to-read policy profiles, they are a little bit different from the rapid response briefs and the policy briefs. So these ones just present the entire evidence in form of bullet points with the use of a few cartoons here and there to break the monopoly of bullet points. So we've piloted this kind of structure on 2 different policy dialogues so far, where we provide the policymakers with the easy-to-read evidence profiles, then also provide them with either the rapid response brief or the policy brief. And compared what we've seen with the policy dialogues where we provide the usual kind of evidence. And to our surprise, for these policy dialogues where we presented the easy-to-read policy profiles, evidence profiles, the policymakers are more informed heading into these dialogues. So it is basically because you've given them all the information they need within a form of bullet points, and the policymaker will only go to the bigger document to try and expound on a particular bullet, which probably they think they need more information about. That is the other way we've done it. Then when it comes to the citizens' engagement into the policy process, we started off using citizen briefs, which is more or less the same as a rapid response brief, but easier language. But we've moved on to using illustrations, which we are terming illustrated evidence profiles. So the illustrations have mostly illustrations with minimal to no words. In that the citizens, when they interact with this evidence in form of illustrations, they can easily pick the message you're trying to send across. And if you're going to engage the citizens in an informed discussion, they also come to the discussion table informed by the evidence you've already provided to them. There are key questions about how we produce these illustrations and whether we are sure the illustrations communicate, but we go through a rigorous process. So we usually get a team of illustrators. These are not permanent members of ACAS, but we co-opt them every time we are going to do such an exercise. So we get the illustrators to come in, give us the first round of illustrations. We get the ACAS team to interact with these illustrations and do different modifications to them. Then we get citizens and bring them and ask them to tell us what they understand from the illustrations we are providing them with, right? So from the kind of feedback we get, we know what needs to be changed. Other citizens tell us if this is the information you want to present, then this illustration should be twitched to depict something different. So after you go through all that process, then we use these illustrations to engage citizens in an informed discussion. Then finally, this is something we are just starting out sometime this year, and probably I can put it out here because very soon we are going to reach out to the different evidence teams within this room. We are going to try and pilot the use of audio for evidence. So instead of providing the policymakers with all these beautifully written documents, how about if we transform this evidence into audio in form of a podcast where we have someone asking questions, another person responding to the questions. So if the policymaker is driving back home and they are in jam, they can play this audio on their radio, and by the time they go through 30 minutes, an hour of traffic, they've already interacted with the evidence more than you could probably it would take probably longer to read the evidence profile or something like that. This is something we are going to pilot, but we are going to reach out to different teams to get them to engage with us so that we can collect rigorous data to compare how this is going to, the impact and how this is going to work out. So I've just let the cat out of the bag, but definitely before the conference ended, we are going to talk about this with the different teams. But that is something that we are also going to try out. So as I said, we keep thinking and trying our level best to see how best we can do this. So more ideas will always keep coming up, but so far, those are the things that we are really trying out with.
Okay, thank you. I'll go to Vicent. There were several questions raised, ranging from what are the knowledge management processes, how receptive is government, and so many others in a minute or two.
Yes, I think I will try to use an example of a recent study we have conducted and how we have done it. Hopefully that will answer the issue of inclusivity, where the youth coming in and others, and also it may partly answer your concern of how other various stakeholders contributing to the knowledge management. So under the APEX framework, we have what we call eco-knowledge management system, whereby like for instance, in this case, we did a study on commercialization of agriculture and its impact on local economic development. We're trying to find out what interventions have gone into commercialization of agriculture over a period of 13 years. That is from 2010 to 2023. And we are trying to trace to see what has gone there, what has worked, what has not worked, and what needs to be done in order possibly to achieve the intended objectives. So in the process, we had to conduct primary data. There was a diagnostic study funded by UNDP, which we built on, and then we got some primary data to try, because the diagnostic study was basically based on the secondary data, but we had to go and down and also collect some evidence from where those interventions went. And we collected some information through talking to the beneficiaries and conducting some group discussions and picking some information from the leaders in the countryside. And then when we came up, we are tasked, like in government, we have various institutions charged with different mandates. For instance, Ministry of Finance mobilizes funding and allocates. So we asked the Ministry of Finance to get us all a compilation of all the intervention, the funding that went into interventions to promote commercialization of agriculture in the local economic development. So they gave us all the kind of money that was spent even on other related interventions that were meant to promote commercialization of agriculture. Then we have Office of the Prime Minister, which basically coordinates implementation of government programs. So on a yearly basis, they conduct performance evaluation of those interventions. So they gave us information from their own perspective on how the interventions have been appraised on a year on for the last 13 years. Then we tasked National Planning Authority to give us the milestones in the National Development Framework. Then we tasked the EPRC, we tasked these other stakeholders, the ISO, for instance, that is the Internal Security Organization, to also get us their own information. We read the work of Josephine in that specific sector. So we integrated all this and synthesized and came up with a report which we subjected to all interested groups, including the youth, women, and the farmers. And from there, we came up with key recommendations that we pushed through up to the steering committee, and now the report is ready for cabinet to pronounce itself. So first of all, that's how we gather information from key stakeholders. Then we publish it. After cabinet has pronounced itself, it can be found on the website, and certainly we shall run press briefs on what outcomes came out of that, and that's how we manage. So if you are looking for that kind of information, you can always find it on our website. So we publish by putting that kind of information on the websites. We publish by putting some highlights in the press, and also by having documents in terms of series 1, series 2, series 3. So those documents are there. If you are looking for that kind of knowledge, you can find it, which is an integrated knowledge. Then there was an issue of is the government effective in utilizing evidence that is brought to it? I would say yes. It is not only, is it in Ghana, where some interventions are abandoned, and then you bring information to government. We also have the similar situations here. So once we get that kind of information from even the whistleblowers, as you have heard from Josephine, we try to find out what exactly is the problem. What are the underlying causes of this kind of thing? And quite often we find that possibly the beneficiaries were not consulted. when the intervention was being formulated. So when you put it there, certainly people can't use it. So we come and try to influence change of policy in terms of how we conceptualize and formulate our projects, and then we come up with various policy guidelines on how we should approach. And I think finally it was the issue of inclusivity from my sister there, which I have, I think, talked about, because we try in as much as possible, especially at the pre-apex level, when we are validating, we try to call all various categories of stakeholders to come and participate and share their views on how best we can promote or maybe shape a recommendation that will inform policy for effective results.
Josephine, in 2 minutes.
Thank you. Let me just pick two, and then I can hand over back to you. The issue of where is the evidence published. So for the government, is the government evaluation facility, the general reports that come from the evaluations. But for the parliament, especially the research department, we have a portal, drs.parliament.go.ug/8082. And when you put this in your URL, you'll be able to see the different reports that the department has published. So what we do a one-pager document called Hot Topic every week, and we divert members of parliament through this hot topic to this portal. So we'll pick a report on a specific issue, let's say road safety, talk about it, and then tell the members, put a link and say the full report on this can be found on this portal. And then on the voices of the young people, so Parliament of Uganda is very well structured in terms of representation. So we have youth as a special interest group that is represented in Parliament. So whenever issues emerge that relate to the youth, we use these special interest groups as the voices of the people. So just to point out that as we try to advance evidence, the evidence is important, but also who is talking is also very, very important. So we try to identify these evidence champions so that they are the ones who speak with the evidence that we have given to them. Thank you.
Thank you very much. I'm going to give each panelist a maximum of 1 minute to give us their recommendations on how to make progress going forward. I'll start with my most immediate neighbor, Edward.
Thank you very much. So what I would say from KT practice point of view is that we should just ensure to keep on building relationships with the policymakers. And where possible, let us try to formalize these relationships. In any engagement, there is the role of the informal kind of approach to a relationship, but also the formal one really plays a key role. As ACAS, we've previously entered an MOU with Vicent's office, the Apex platform. We have an MOU with them where we are going to keep on working with them on different knowledge products to try and support decision making. We also have an MOU with the Ministry of Health. So these MOUs have their role they play in the relationships, but also don't throw away the informal kind of relationships, because informal sometimes plays a key role in this, because not every time someone is going to send you an email. Sometimes someone just wants to send you a text. Sometimes you're going to meet the policymaker probably for coffee or at a bar, and if you don't have an informal kind of relationship, they'll never approach you with a policy question. So just the policymaker seeing you somewhere, they should be in position to approach you because you've built this kind of informal relationship with them. Then you can be able to support more and more of these policy and decision-making processes within government.
Thank you very much, Edward. Josephine, your final word on how we make progress in a minute or less.
I encourage us to keep engaging, that one time, one day, your evidence will be picked up. But even as you engage, be timely, be relevant, and be focused on what you want to influence. Thank you.
Vicent, your final word.
Yeah, networking, collaboration, and creating platforms for knowledge sharing, I think are very fundamental in the use of evidence.
Thank you very much. Unfortunately, we've run out of time. I wish to thank our audience, the physical audience here, as well as the online audience for the engagement. A very big hand clap to the panel this morning. Thank you.
So colleagues, we have a 5-minute break, which is really just a comfort break to allow you to switch rooms if you want to. So there are now 2 sessions following this. There's a session in here, which we're calling a localization funders panel. And I don't have my program, but if you check your pocket program, oh, actually, no, mine's over there. Check your pocket program and you will get the details of the session downstairs. So you can either stay here, pop out to the bathroom, or move downstairs if you prefer. We're starting back in here in 5 minutes.
Hello. Yeah, my microphone is on. Can you hear me? Can you hear me? All right, I'll go mute.
Andrea, this is Bertha. We're just about to get started. Right. Good morning, everyone. Thanks for being here. My name is Bertha Snilstveit. I'm the Director for Synthesis and Reviews at 3IE and head of our London office. I have the great pleasure of co-chairing this session with Harsha Dayal from DPME and AEN in South Africa. I'll hand over to Harsha in a minute to introduce herself a bit more and our panel. But first, just to say a few words, kind of framing why we are doing these sessions. So, as I'm sure you all know, concepts such as localization and decolonization has gained prominence in the development discourse in recent years and are increasingly featured in the policy statements of major aid agencies, for example, and funders. And at the heart of these ideas are objectives around local ownership, agencies with the resources that today are close, that are going to primarily northern organizations, directed to a larger degree to organizations in the global south. The rationale for this agenda is both one of equity and ethics, but it's also one of effectiveness and relevance. As been made quite clear, I think, so far in this conference, a key theme is the importance of national evidence generators and brokers for effective and sustainable institutionalization of evidence. And I think, the point was made yesterday that EIDM also has a role in improving the functioning of the state, which further highlights why the importance of national actors driving this agenda. But these ideas are not new. They've been coming and going in development discourse. Despite these stated goals and of many actors, the development in the development and evidence communities for decades, progress is still limited in terms of resources and voice. So, for example, a study from 2021 looking at the articles published in top development journals found that between 1990 and 2019, almost 3/4 of the articles were published by Northern researchers. We've done a similar analysis of data on our development evidence portal. There the picture is looking a bit better, and that might be because we're also including grey literature, so unpublished studies. But there is still huge amounts of literature being published about countries in the Global South with no authors from those countries. This event has so far highlighted the energy and creativity and capacity of you all and across the continent. And so imagine what would be possible if the resources were a bit more equally distributed than what it is today. So why have we not made more progress? Why does most of the funding go to Northern organizations and researchers in the North? What are the key barriers to localization? And what are promising strategies for addressing these barriers? And how can national and global organizations work together to facilitate a shift? So these are the key questions that are motivating this panel, and the panel will be followed by a workshop. So we really hope that you will come back after the break and help come up with very concrete and constructive ideas based on your experience for how we can together make more progress towards greater localization. And so with that, I'll hand over to Harsha.
Thank you so much. I didn't put anything on, so this is working, right? So thanks, Bete, and a very warm welcome to our panelists. My name is Harsha Dayal. I'm Director of Research and Knowledge Management in the Department of Planning, Monitoring and Evaluation, DPME in short, in the South African Presidency. So I think this localization opportunity for this hour, Adeline yesterday had thrown a challenge to us, and I think we can take this challenge head on to start unpacking this issue of localization. And very nicely, I think, other than the evidence agenda, you also put out, is localization a metaphor? And, you know, on the other side, it really is about coming home. And I don't know if we want to ask ourselves, is localization the opposite of globalization? So it's really more than that, right? But I think for us, coming home means, and maybe let's stick with localization if you don't, even if you don't agree with the definition of it per se. It is about identity, about belonging, and we talk about cohesion, right? But then I'm really intrigued to hear from the panelists, because when it comes to the evidence agenda, it's about, from a public perspective as well, these multiple realities and who's defining these multiple realities. So we really want to hear from the panelists. You do have it in your packs where the panelists do come from. I don't want to take up too much time in introducing them because we really want to hear what they say, but they are, we're going to go in this order. So Sajelu Kamwendo, he is from the MasterCard Foundation, Outcome and Impact Evaluation Director. We have Andrea O'Donis-Lianos from Executive Southern Voice, and she's joining us online. Then we have Chris Chibwana, he's Program Officer from the Hewlett Foundation. And then we have Maurice Motsia, just on my right-hand side now, from Kenya, Director of Research from the CZ Africa Foundation. So, colleagues, I think I'm going to say to you that we want to pose very specific questions to you. If you can take maybe 3 minutes to introduce yourselves if you need to still, and your reflections and perspectives on localization. So, Sajelu, let me start with you, right? What does success look like from your perspective in the localization agenda?
Thanks, and good morning, everyone. Sajelu is my name. I work with the MasterCard Foundation. So briefly maybe about the foundation. What we're looking at is to accelerate opportunities for young women and men, transitioning them to dignified and fulfilling work. We have Young Africa Works strategy, aiming at 30 million young women and men. And then we also work with indigenous communities in Canada. What does success look like when we talk localization? First of all, acknowledging that it's a very difficult conversation, but MasterCard Foundation has a position on that. Firstly, we have moved from Canada to establish presence here in Africa. So our offices are here. We do have programs in Canada, but you find most of our senior managers, most of our people here. And we are committed. We have clear goals in terms of working with local partners. Our current goal is to work with 75% of local indigenous partners. What does success look like? I will focus on how we do impact or evidence. We have a strategy, our impact strategy. One of the key aspects there is around what we call honoring indigenous ways of knowing. Very clear about that. There's no ambiguity. We acknowledge that we should honor local context, we should honor local ways of knowing, because we know that what gets measured is political. We want to measure what matters for the young women and men in Africa and even our indigenous communities in Canada. Success as well means inclusion. We have to acknowledge, I think my colleague Adeline spoke about decolonization. Most of us, myself included, much of my education really was a product of colonialism, studied anthropology, and much of my readings in anthropology were coming from the global north. So we need to talk about how inclusive the field of evidence is. We also need to celebrate diversity. Africa is a continent of diversity. So for me, success related to inclusion is diversity. When we say we measure what matters, so what matters for someone in Kitgum in northern Uganda might be different for someone in Kalashane in Eswatini. So appreciating that diversity as well is important. And then non-extractive ways of getting evidence as well. Evidence Sometimes we can be very extractive. I've been guilty of that, guilty as charged, but acknowledging that as we collect data as well, it should not be extractive. And then maybe lastly, really, just to come back to measuring what matters, as a foundation, we're doing quite a number of measurement processes across the continent. In Africa and Canada, we just rolled out baseline surveys around youth employment. Before doing that, we reached out to young women and men and said, what does it mean for you to transition to dignified and fulfilling work? And we went beyond the numbers, talking of quality of life. What does quality of life mean for the young women and men we work with? I'll pause here for now. Thank you.
Andrea, is she online there? Can we get Andrea
Yeah.
online?
Hello, can you hear me?
Andrea,
Yeah.
while you're coming online, same question. Just to reflect for 3 minutes, what does success look like from your perspective in the localization agenda?
First, thank you for the invitation and for welcoming me virtually. Can you hear me now? Can you hear me now?
Which is 5 different strategies, but I think the one that's more relevant to this work is what we call the evidence-informed policy-making strategy. And the goal there is to help governments in East and West Africa to more systematically use data and evidence for decision-making, supporting the work of think tanks. I think a lot of organizations that are here have worked in one way or another with the Hewlett Foundation. And so I think within that context, localization is a big issue. It's a big priority for us. And I think I'll speak about why that is, and then get to the question of what does success look like for us. So we just went through a refresh of our strategy, which we've been implementing since 2015. And I think one of the things that came very clearly in the evaluation of the previous strategy is how we get to impact. That I think we found that relationships between policymakers and evidence producers and evidence translators, brokers, whatever you call them, trusted relationships are critical to bridging that evidence to policy gap. And the closer that actors are to policymakers, the easier it is to bridge that gap, to build that trust. Now, you can do that if you're operating from outside of Washington, D.C., or the western part of the US, but it's just harder. It's easier if you're in Kenya, the policymaker is in Kenya, you're in Uganda, the policymaker is in Uganda. So I think we're using the term proximate instead of local, proximate actors, which could be actors that may not necessarily be entirely African, but they have their whole staff based in Ghana, they have the whole staff based in Senegal. They're very close to the policymakers that we're hoping to help. And so for purposes of impact, it just makes sense for us to work closely and support the work of those proximate actors. It's also just sustainable for the work that we do. I think there's an example from during COVID, when COVID first happened. I remember I was in Zambia back in 2020, working for, well, a somewhat proximate organization. It is a proximate organization. And other organizations that were not non-African, had a lot of non-African staff. What happened, I think we all saw that there was just an exodus of people. People just left and went back to their countries because everybody was afraid that COVID would overwhelm our health systems in Africa. And these were people that were working with policymakers, helping them make decisions. And as you all remember, during COVID was when we saw the most demand for evidence. But those people left. And then our policymakers were left to their own devices to make decisions. The organizations, however, that were local and proximate still had their staff in Africa. And they continued to work and help the policymakers to generate evidence around school closures, school reopenings. And then after those waves of COVID went away, those people came back and then they tried to make themselves relevant again. So you see how from a strategic and impact and a dignity perspective, it just makes sense to support those that are very close and proximate to decision makers. Now I'm preaching to the choir because I think we all believe that it's important. But I think for us then, what does success look like? I think there are two elements. One is that the proximate actors that we work with have more capacity to do their work. So that's capacity to generate evidence, to communicate that evidence to policymakers. But then that also goes with resources, that they actually have the budget to be able to do that work. That I think if we combine those two, we'll have a stronger ecosystem of proximate and local organizations that are close to policymakers that in the long run will continue to support this work and support policymaking.
Thank you so much. Andrea, let's check if we can hear you. We're not seeing Andrea. Can online support please help us there? All right. I hope we're going to, apologies for that. I hope we're going to be sorted after the last of our panelists. Okay, are we trying that?
Hello?
Good, we can hear her, but we can't see Andrea.
Can you hear me now?
We can hear you. Can the volume be up a little bit? There we go. Andrea, we can see you, or we hope we can hear you. So Andrea, let me just pose the question again, and for you to reflect for the 3 minutes to on your perspectives of localization. What does success look like from your perspective in the localization agenda? Thanks, Andrea, over to you.
Thank you, and thank you for the invitation to join virtually. I'm Andrea Ordóñez, I'm Director of Southern Voice. We're a network of over 60 think tanks across Africa, Asia, and Latin America, working on informing issues around sustainable development. I think that from our perspective, I was trying to think how to bring forward our way of working with the issue of localization. And I think for us, it's very much a vision of what maybe we could call a localization plus agenda. While we agree with the vision shown until now about localization and the relevance of local actors for their policymakers and for the discussions nationally, the plus that we believe in is that the organizations that are working locally across Africa, Asia, and Latin America have not only the capacity to inform policy at their national level, but also at the global level. So that's why I would put the plus there, because I think that for us, it's not only about localization in the sense of reducing the scope of work of these organizations to what happens locally, which may happen, because of the use of this word. And I see Chris suggesting a different phrasing also around it. But so for us, it's a vision of course, we need strong institutions and strong organizations at the nationals and local levels across the Global South. And we also need these organizations to be able to influence global debates. And that is because we do want to cut through these perceptions that we've developed across the research ecosystem, that when knowledge is developed in the global north, it's universal, and when it's done at the global south, then it's just particular and contextual, right? So we want to make sure that we, in the process of strengthening organizations in the global south, we do not perpetuate this perspective, but that we actually break it. And that's we can talk about localization plus. So strengthening local organizations for local evidence, but also for global influence. Thanks.
Thank you so much, Andrea. Boris, over to you.
Yes, thanks and good morning, everyone. I can introduce myself. Mutisa Morris. I work with the Afrique Foundation. And I want to begin from that perspective. This Afrique Foundation, we are 5 years old, is a local organization based in Kenya, locally founded. And we have been immersing ourselves in this debate around localization and what does that mean for sustainability and growth of the institution itself, but also the work that we do within Kenya and in the region. Our mission is all children and youth learning and thriving, and we are very much focusing on foundational skills, particularly literacy, numeracy, and social-emotional learning, which we think are strong foundations for children, for them to be able to grow and to be able to thrive in life. And we do that through evidence consolidation, through innovations, and as well as engagement. And for us, one key thing around localization is that you cannot be able to generate evidence without resources. So they go hand in hand. And in that case, we believe if we have to localize, one element is try to get the resources where they are also most needed. But then with that, examining that, we also examine it with a bit of contrast, also local funding. That is also essential for us. As much as we want to talk about localization, I think also pushing for local funding from our governments, from philanthropies that are based within the continent and within the countries that we are working in, so that as resources also trickle down, we also contribute into that debate and also the development agenda of the region. But I want to focus on the localization also again around three elements and the success of it. 3 points, 3 or 4 points. One is about equals, where we see success is when institutions that are working within the context that we are in, and the global north and the south, there is kind of equality now. We treat one another, and I think that's critical when you're moving with the agenda, and that is tied closely to the shared value. And one of the values in the system is around issues of respect and trust, because at the end of the day, we get resources from the north, and we get that resources, the trust that we can be able to deliver, we can be able to do the work that we have been entrusted with. And I think that when we have that trust and respecting the relationships that we have with the global north, I think that's become so critical in terms of growing and ensuring that localization itself thrives. I also want to reflect that around agenda setting, and I think the agenda setting of the work that we do, we are in a context where we are immersing ourselves with the experiences, we're immersing ourselves with the key issues that we need to be able to research on, issues that we need to be able to generate evidence on, issues that we know affect the populations that we want to serve and the children that we want to grow in terms of the education, where I'm coming from, the space of education. So, and I see localization in terms of that kind of a balance of what is global need, but also what is locally relevant. So that as much as we are working, we want have the ideas and the things that we think they're so pertinent to the population that they are serving, they're also getting resources to be supported, to generate the evidence, but also to engage better. I also want to, I think there is the element of capacity, and I think I see success whereby the local organizations have the capacity. And capacity for me is a little bit broad. I look at it in terms of the skills of the people that are there. I look at it in terms of the leadership. I look at it in terms of the systems that you do have to be able to even manage the resources that you have been given. I look at in terms of the element whereby there is even trust within our governments. And I want to pick on that because localization agenda is also tied to how are we going to utilize the evidence that the local organization utilize it, because we are utilizing that evidence for impact. And one thing that I've also seen is traditionally the governments coming in place and saying, I think we need this evidence. We can trust the evidence that we are generating. So in that space, it means if we are localizing and there is the capacity, there is the will also by the governments and the different stakeholders that are working in to be able to utilize that evidence for impact. Otherwise, we could be able to localize, we could be able to generate evidence, we could be able to write papers, journal papers, but it's actually not translating in terms of the lives that we need to effect. And lastly is about peer learning, where we are learning within the region, but also globally, because, and I'm a strong believer that localization doesn't necessarily mean having institutions that are inferior. It means growing institutions that can be able to compete at a global level. It means having institutions where the leadership is strong enough such that it's ethical, it's creative, is innovative, and can be able to compete at a global level. Otherwise, I don't see localization as a way of babysitting organization. I'm seeing them as a way of growing organizations to become competitive and to be organizations that can be global think tanks within the continent. Thank you.
Thank you so much. You've given us so much to think about already just by looking at success from the angle of success. And Maurice, you brought out this relationship with government. So on the other side of success, maybe the second question we want to pose to you. I'm not sure if I want to go in the same sequence, but Sujela, you had a little bit of time, so maybe we can start with you again. On the other side of success, then what are the top 3 barriers for you to localization, which also includes shifting of power, which we already, all of you have touched on that, as well as resources to organization in the global south, which Maurice has also said. So, you know, from the other side of successes, what are the top 3 barriers to localization?
This is the question I read the most. What are the barriers to localization? The first one, as we talk localization, localization has to happen within an ecosystem that supports that agenda. So that's the first point that I need to make. We see efforts towards localization in different shapes and sizes, but largely it's fragmented. So, and I want to recognize that. I mean, for something to gain traction, someone has to start doing something. So there is a lot of fragmentation, especially in the evidence space. So probably if we start dealing with that, where we invite people to say, let's sit around the fire, and how then do we come together and create an ecosystem that supports local institutions. The second one relates to the local institutions. We're looking at, we talk about building at the foundation, and what we mean by that is that we want to help and support local institutions to be more assertive when it comes to knowledge generation. So we find that their visibility sometimes is very difficult. Where I sit, I commission and manage evaluations, and when I'm looking for local firms, sometimes I have to admit it's a bit of a struggle. And then because of the pressure of work, you have to deliver these evaluations. You begin to say, who else can do this? And the default setting, unfortunately, sometimes is up north. So probably challenging people in this community of evidence generation as well to say, yeah, let's be more assertive, let's be visible when it comes to this as well. That's the other aspect. Of course, history, I'll go back to history. Adeline spoke eloquently about that. I mean, we have to acknowledge that when we talk about evidence, there's issues of, is this valid, is this credible? And then sometimes validity and credibility as gatekeepers. So again, that's another barrier as well that we need to talk about. It's not easy, it's a difficult conversation, but I see that as well as a barrier that we need to work with. Thank you.
Thank you, Sergio. Such spot-on answers, and also keeping it nice and tight, because those, each one can be unpacked, I'm sure. Over to you. Let me just check if Andrea is there in the audience to just keep with that. Andrea?
Yes, thank you. I think I would stress two challenges that the researchers that we've been speaking to across the Global South have highlighted to us. And then the first one is the issue of agenda setting, that if we transfer funds, if we transfer capacities, but we don't transfer the decision making on the agendas for research, then we are not fulfilling the aim of localization. And I think one of the reasons why we see sometimes these attempts at localization but that don't maybe stick, or that they don't last, is because they are not based on actually giving the power and the agency of leading on the agenda, topic setting to the organizations that we want to shift the power to. So I think that's the one, because if we don't do that, then we're going to keep seeing organizations do some research, but then trying to steer towards the topics that they feel are relevant, right? So to sustain the prospects of localization, we really need to start with shifting the decision making around the agenda of studies and evidence creation. And then the second one I would add is a more persistent problem around the measures of credibility and quality that we use. That is also a very critical concern, because funders, national, international, they are all kind of like using different types of indicators and shortcuts to figure out who is doing good research. And right now, those shortcuts are stacked against organizations in the Global South, because if it's about publishing in high-ranking journals, if it is about having these publications that as the most important signal of quality, then of course the organizations, the local organizations, may not appear as credible and as trustworthy to donors and other actors. So that is something that is a more strategic and structural change that would be needed, and that I think would help also not only the equity and the quality of research in the Global South, but also in the Global North, because it's really targeted towards having a very small number of highly prestigious organizations, institutions, and journals. But we know that that is not the only marker of quality. In fact, one of the researchers we were talking to said it better. He said, now we don't care what we research, we only care where we publish it. And that is something that affects, of course, the localization agenda, because if these local issues are not relevant, are not seen as something related to quality, to trustworthy, then it's also going to keep failing. Thanks.
Thank you so much, Andrea. Chris, over to you. The top 3 barriers for you.
Yeah, so I think I'll touch on what I think others have mentioned. From sort of a funding perspective, I think there's just the issue of trust. That there's a lack of trust in local, the ability of local organizations to, one, set the agenda, sort of identify the right priorities, but then also to effectively use and manage funds, which then leads to a preference for international NGOs, international think tanks. And I'll speak about what we're doing as a foundation to try and do that. I think we practice what we call trust-based philanthropy, which is, you don't see Hewlett put out RFPs. I think we've only done that once as our evidence-informed policy-making strategy. All of our projects, all of our partnerships are co-created, that our partners are the ones that are in the lead. To the largest extent possible, we provide flexible funding, which then allows our partners to be able to flexibly respond to the needs of policymakers. Because I sit in the San Francisco Bay Area, the western part of the US. I don't sit here in Africa. I'm very far removed from the issues, from the problems that are happening. Yes, I'm African, I have the lived experience, but I feel like somebody who's in Uganda, ACAS, or our other partners are much more closer to the work and should be the ones to determine what really the priorities are. And so I think we, as a foundation, we're trying to shift as much of that decision-making power as possible and to simplify our processes. Because I think the other challenge with localization is just structural or institutional within the funding landscape. There's so much bureaucracy. I think you all know which funding not to apply to, because it's just going to kill your organization. You'll be asked for 200 pages of documents as part of the proposal. When it comes to reporting, you have to do 100 pages, and you have to do that every quarter. By the time you finish submitting the report, you're already working on the next report, and you don't have time at all to even do the work that you're being funded to do. And so I think as a foundation, we're also trying to change that and trying to find like-minded organizations, like-minded funders to begin to change practices. So if you look at our proposal template, if you've ever been invited to apply for funding at Hewlett, it's a maximum of 10 pages that you provide, and that's all. Our budget template is just 1 page. Our reporting, annual reporting, you report once a year, and it's a maximum of 15 pages. We don't even want any annexes at all, because we want to keep that burden as low as possible. And so what we're doing is then beginning to share these practices with other funders, hoping to begin to change overall practice, knowing that I think for other bilaterals, there are obviously laws and other systems that may not allow them to be as flexible, as nimble as we are, but I think there is scope for us to work with like-minded funders to begin to change those practices so that it's actually easier on local organizations to be able to access funding. And then I think the third is just these language and cultural barriers. I think Francophone West Africa is probably the one place that comes to mind that a lot of us don't even know how to work in French. I think we're all very comfortable working in English, that when an organization comes from West Africa, there's an amazing organization, ACED, in Benin, that does amazing work. Thankfully, they're bilingual, but there are others that are not bilingual at all. And so when we see their proposal, and they've translated it using Google Translate, it doesn't render the same. Evidence terms don't come across the same. We just think, this is a very poor proposal. There's no way that I'm going to fund it. So we haven't invested in the systems ourselves to begin to understand the culture within these other ecosystems where we may not be comfortable working. And I think as a foundation, we're also trying to change that. One of my colleagues is actually from Senegal, and now is based out of Senegal, working, helping us to understand that region a little bit better and oversee that grant making within that region.
Thank you so much, Chris. Maurice, over to you.
Thanks. I just want to pick a point, a starting point from Chris, and particularly around the issues of standards and requirements. If you look, coming now from an implementing organization, most of our funding is project-based. And if we have several donors that have different requirements, reporting timelines, and yet that project is not paying 100% of the time, it means someone has to cut across the 2 or 3 projects, and you have to report. So you spend so much time. I agree, Chris. I think that's, if we can get harmonization around reporting and requirements and standard, I think that would be critical. The second thing is around, I know it's good to do due diligence, to be able to know where the organizations are, but I think there is a positive aspect of it, of also working with organizations to be able to grow where there are weaknesses, and particularly financial systems, because they also cost money to invest on that. And if you do not have enough core funding, it means you may not have a very robust kind of financial standard systems that can be able to grow you, can be able to speak to the various requirements that the donor needs. So that I see as a barrier. And flexibility is also in terms of the funding. I know we tie most of it towards project activities, and in that a bit of flexibility in how you can be able to learn out of that work, other than output-based, but then flexibility whereby you can also be able to try some other things that are emerging within your system. I think that will put a lot of trust in delivery of organizations and making organizations to be able to think outside the box. But then one key barrier I also note is around what you mean by localization. Do you have a common understanding around localization? And what models are working in terms of localization? And I'm happy to see quite a number of funders are now opening offices in this part of the world. Is that localization in the first place? The second thing that I'm seeing is also models whereby some funders may give, like you may get a university in the UK getting resources and then subcontracting a local organization to implement that. Is that localization? So I think if we can be able to develop a common understanding of what localization is, and that has a mutual benefit to the funder and to the local organization, I think that will be critical, such that we break that barrier. Otherwise, if we see several models, then it becomes elements whereby we are implementing, but actually we are not even in control of that evidence moving forward. But then there's also the issue of capacity. And I want to reflect this again on different note from my previous one when it comes to barriers. And this is in relation whereby we have great minds in this part of the world. But in most cases, by the time you're emerging, also the global organizations snatch you. Then we are left again, that organization is like growing leaders. Anytime you thrive, then you're also gone. We have, so what does that also mean? And I think you can't control it, the brain drain, you can't control it. But I think within the context that we are in, is also finding ways of how to be able to keep those talents that can be able to help us maneuver some of these challenges, and particularly building a strong organization. I come back to the element of local funding, and I think that will still continue being one of the critical things that we need to continue investing in, and urging our governments to put some resources into research and advocacy. And tied to that is, you go to most of the African countries, they have created the National Research Fund. but it's geared towards STEM. Social sciences, you find there is actually very limited funding that is going there. Yet, we need a lot of evidence around these social issues. Education is social, these social issues. But if we focus on STEM alone, we create these technology, but they also have their own social elements into it. You cannot have growing someone STEM if they have not gone through quality education, if they are not living a healthy life. So we need to know these things are interdependent, and the localization aspect of it, also getting investments into it, I think that will be critical. But then there is a sense of responsibility that comes into it. And there's the ancient saying that too much is given, much is also expected. So it's standing up and saying, we need to deliver, we need to stand out, we need to showcase that we can actually be able to do it. Because you may have organizations that are invested with resources, but then they are also grappling with other issues of ethics or issues of trust. So that becomes so critical. And my last is around a united voice. I don't know, how do we work together? How do we speak the same language of localization? How do I speak today here and tomorrow go to a different forum and have a different language that I'm using? How do we grow that? How do we grow and focus around localization, building systems that we are growing one another and we are able to become resilient as we become globally competitive? Thank you.
Thank you so much. Bertie, do we have time for one more question, or can we open up? Maybe. Okay, yeah, then we got. So, colleagues, a lot of food for thought, and in short time spans, the panelists have shared so much. Anyone with questions from the floor? And I'm not sure if someone's monitoring the online as well. I see a hand up there. 2 hands there. Okay, 3. Let me just say 1, 2, 3, and then we'll come on this side. Yeah, I see you and I see you.
Thank you very much, colleagues. I'm monitoring the online feed. So this is a question from Martin Kapchanga, who's asking about how do we balance the benefits of funded projects to ensure that they're sustainable beyond the funding period. And I think that's an issue all of us have faced, whether we're funders or recipients of funds. So it'd be great to have your perspectives on that. Thank you.
Thanks, Ruth. I think we just keep that question and we take, there was one behind you and then another one, and we'll come back.
So thank you so much to our panelists. My name is Diana from JPAL. So my question is with regards to the length of funding. So knowing that the policy-making process usually can take a very long time before we actually see change or impact, I'm wondering whether the funding community is thinking about how do you innovatively have longer funding timelines. For instance, sometimes you can find funding is for 2 years, and maybe for you to be able to effectively influence policy, it may take up to 3, 4, 5 years. So sometimes you find institutions sort of leaving the processes hanging or trying to find other alternative ways to keep the process moving forward, sometimes with limited success, sometimes they're able to do better, but it would be great to hear what solutions are there.
Thank you, Dee. One more question, Bear, and then I'll come back to the panelists. Thank you.
Yes, thank you very much. I just wanted to delve deeper into the concept of localization. And so in my mind, I think of 2 things. There is localization, meaning at the grassroots, but there is localization talking about an African context. What does it mean in most of the funders' frameworks when they speak about localization in that sense? Because I work for PASGA, the Partnership for African Social and Governance Research. And while we might not be doing a lot of work in the grassroots, we do our work across Africa. In that sense, we are localized. But how that mean, correspond to the ideas that have been raised here with localization? Thank you.
Okay, thank you. I'll come back to the other questions. I don't know if there was funding related and then the question of localization. It's not posed to anyone specifically. Anyone from the panelists to jump in?
Okay, I'll combine the question of sustainability and length of funding and just talk to what we're doing as Mastercard Foundation. Sustainability is a big issue in development. And in fact, in one of our reviews, we identified sustainability as one of the key aspects. So we look at sustainability, resilience, because we live in a world of multiple shocks now, and then the aspect of equity. When we look at sustainability, we have come up with what we call a portfolio approach to programming. So when we say portfolio approach, we recognize that the issues that have been related, we talk about access to finance, for example. When we talk about access to finance, it's not only about working financial service providers and saying we can extend loans or grants to young entrepreneurs, but also there has to be the environment that encourages innovation, an environment that encourages the young woman to go into business. So we bring different layers. Some of them also look at issues around policy, some look at mindset, some of the financial service providers. And in the portfolio approach, when we take a big bet, where we say we do multi-year funding, and when it comes to measuring actually on a regular basis, we also look at what is happening in terms of system change. So moving away from project by project funding to what we call portfolio approach. That really supports multiple players because we appreciate that where we operate, there is different challenges. So access finance does not necessarily mean working with a particular financial service provider, but we bring other players as well. So we talk about transformed financial inclusion or transformed access to finance that goes beyond your regular transactional aspects that you're saying, how we see commercially viable products that local financial service providers will continue offering way beyond the line of the foundation's investment.
Please.
Yes, I think the question around localization, what do you mean by that? I think for us, it's interesting because we mentioned earlier, we're almost finalizing our new strategy. And our first outcome of the strategy is actually focused on localization, providing support to African organizations. And I think that's in terms of both funding but also capacity building, that we want to capacitate African organizations, proxy organizations, to improve and expand their operations. Now, that includes growing the pool of organizations. So I think everybody knows, if you talk about organizations that work with governments to help them use evidence, you can probably name 5 or 6 in Anglophone Africa that everybody knows, everybody works with. Maybe 2 or 3 in Francophone Africa that everybody works with. And I think one thing that we don't want to do is create the same dynamic between these large African organizations that we're seeing, between the global north and global southern organizations, that you could then just create a Brookings that's based out of Kenya, that's working in all of Africa and there's nobody else. So it's also for us, for the next several years, is looking to serve as smaller, less well-known organizations that may not be as sophisticated as the usual suspects that everybody wants to. And then bringing those up, building their capacity, providing resources to them so that we diversify the pool of organizations that are working with governments and providing different forms of evidence to governments. So I think that's a big priority for us, and it's an outcome within our new strategy. And then to the point, I think, from the question from Dale around the length of these grants, being 2 years, 3 years. I think more so than a specific grant, for us it's a commitment to longer-term partnerships with our grantees. Yes, the grant might be for 3 years, but I think once you enter into a partnership with Hewlett, you're going to be in the portfolio for some time. Now, I understand why a 5-year grant gives peace of mind if you're a leader running an organization, but I've also worked for bilateral before, where we actually signed 5-year contracts that were very rigid, and if everything changes, COVID happens, you can't adapt very easily, you can't change, you can't move money between budget line items. Now that's not necessarily a good thing either. I think it's the commitment to working with our partners for a long term, being flexible, allowing our partners to define what those priorities are that they work on, that sort of offsets these longer term, these shorter term grants that we provide. There's always a guarantee, unless something happens, that you get your next grant, and you get your next grant after that. And if we have to exit from the partnership, that we'll do that responsibly. We won't tell you today that this is your last grant and the grant ends tomorrow. Like, you have at least a year in advance. And if we can't do that, provide you with funding, some runway for you to be able to figure out, maybe fundraise and connect you to other people so that you can actually get the support that you need.
Thank you so much. I think I'm going to just come on this side here before we come back to the panelists. So there was 2 questions here. Sorry, gentleman here, and I think Edward there. Can we get the mic to him? I also know that this question, the deeper one on localization, if we can maybe take the panelists on during lunch and tea time, we can start the discussion. Over to you.
Wonderful, thank you. My name is Sydney Sproul. I'm the Senior Strategy Officer at the Uganda National Academy of Sciences. Just one comment and a question, but was just a very interesting thing that I kept hearing was this global north, global south, which somehow sort of implies some sort of directionality. And an example of this is a time where I was talking to a colleague from outside, and they mentioned reverse innovations in Great Britain. What they were saying was they were taking things that were innovations made in Africa, and they applied them in the United Kingdom. And somehow this was a reverse innovation. And I was given a sort of a different way of thinking about this by a wonderful Jewish professor named Judy Lasker, who said we should probably think about this less about global north, global south, but perhaps global minority and the global majority, where the global minority is actually all of those which are in the global north. The second question I wanted to ask was, there's a lot of emphasis, and I keep hearing of this, and forgive me because I'm not an evaluator. Why do we keep talking about impact evaluations when it seems like in many ways we're talking about very, very messy and systemic issues, where the outcome is not always going to be very straightforward? You know, we keep talking about policies as the outcome or the impact that we want to see. We want to see a policymaker to change their practice, their ways of being. But at the same time, we keep saying, but this is really messy. They have so many different priorities. They have voters, constituents to consider. They may think of things one day and change their mind the next. And so there are, though, from what I've heard, a lot of different types of evaluations, such as a developmental evaluation, which tries to focus and interrogate this idea of how do we get to just ways in which we've changed the systems so that we then do have an environment in which impacts can be created. But I keep hearing from funders, impact, impact, impact. And I'm sort of kind of going, but isn't that a contradiction in terms? Because on the one hand, you want to change the system and the culture, but at the same time, you still are beholden, or at least it sounds like you're beholden, to these sort of linear and discrete indicators. Thank you.
Thank you. One more question there, and then come back to the panelists.
Thank you. My name is Benson, and from Kenya. I work for Triple Lane, one of the former Young Impact from Mastercard Foundation. So I'm passionate about localization. So I have three things to challenge the Pan-African. One is about the resources. Two, articulating our own context. Number three is ability to solve our problem. So we cannot run out of the evaluation if we have not done the three circle: the resources, articulation of our own context, and ability to solve our problem. So we cannot shift power. And just as my friend said, the northern global are so powerful than the southern. Why? They have good technology, resources, and a lot of empowerment. So we will remain under the aid of localization if we have not articulated three key things. Thank you.
Okay, sorry, I had the hand up there. That would be the last question, and then apologies to the panelists. Over to you after.
Thank you very much. Mine is not a question, but more of a comment. My name is Fréjus Toto. I'm the Executive Director of the African Center for Equitable Development. We are working on evidence policy and action across Francophone West Africa. As I hear panelists and all colleagues talking about localization, I really want us to start thinking beyond just transferring more funds and capacity from, the global north to proximate or to local organizations, and start thinking about, when we talk about localization, we should also be aware of the need to make sure that those local organizations are really working on local issues, are really embedded into local content. Because you can have an organization which is based in Nairobi, which could definitely be called as a local organization, having all the staff being Kenyan, so we assume that they are closer to the issues. But in reality, maybe they are very far from the issues because they are not that close to the communities or to the problems that they are supposed to solve. So when we talk about localization, we should also be thinking about how we conceptualize that localization so that in the end, the metric that we look will not be how much do we transfer from funders to those proximate or local organizations, but how much do we now shift the power and make sure that those organizations are working on local problems and with local content. Thank you.
Okay, thank you so much. I want to go over to Andrea to see whether she wanted to comment or answer any of those questions.
Can you hear me?
We can hear you. I hope you heard the questions.
Yes, thanks. Well, I think I would just maybe react to the last comment that Fred just brought in, to totally agree with him on this, that it is about like setting the agenda that is one of the most important calls, I think, for organizations in the Global South when it comes to localization. So beyond the funds, which are necessary, but not always the only need. So I think from us in Southern Voice, we see the opportunity of generating those spaces between think tanks and research organizations in the Global South to think through the issues that concern them, their priorities, and be able to position them more globally. And I think this goes in hand with the comments we've also heard in the panel before about the importance of having organizations that are locally grounded in issues, but that compete globally. And I think that's the other thing that I think is really important in terms of the administrative capacity, the capacity to speak and engage with peers worldwide in other regions in the global north and so on. So I think that's really important in terms of the localization agenda moving forward. Thanks.
Thank you so much, Andres. Morris, did you want to comment on any of the questions, and then we'll come back?
Yeah, just a quick one around catching on the last one around localization, and my experience of what we have been able to do around even localizing ourselves as well. We deliver through partnerships, and one of the key things that we have tried to do is bring in those partners that we are working with, and most of them are grassroots kind of organizations, to co-create with them, to think through with them, to identify their capacity needs as well, and to then to grow them. And we believe by doing so, we also try to entrench localization within the aspect, rather than with the national organizations that are strong, getting the funding, and then the grassroots that are actually doing the service delivery on the ground, or the implementing, then having no kind of ideas and capacity development from their end. The other one that I want to touch base is around the long-term funding and the aspect of the change that we want to see, and sometimes I see a bit of tension when you are developing these calls for proposals, or when you are responding to requests or something like that, whereby we as organizations sometimes we overpromise because we need the money. We need the money, so you have a promise. But when it comes to delivery, then it becomes a little bit problem. I think it's also for us to be able to sit at that negotiating table with the funders and tell them, we see this is feasible. Let's begin from this point, and then progressively we grow together towards creating the kind of impact that we want to create. Otherwise, we are setting ourselves from failure at the beginning, and we end up blaming someone else. Thank you.
Thank you. I see we have less than 5 minutes. Is that correct? No more questions. Okay. Bertie, do you want to go? I thought we could do a quick round of just closing statements with the panelists, and maybe you can just do a quick reflection on what do you think you would need from the other person. So I think that we wanted to still explore. Actually wanted to hear about the impact question, but we will take that forward. A quick round of just closing statements. Maybe I can start on my right-hand side, Morris, Chris, Sijelu, and then we'll close with Andrea.
Thank you, and it's an interesting discussion, and thanks for the opportunity and the listeners. I think by reflection, possibly. Concluding on that is the need for a level playing ground, whereby we can be able to engage as peers, where we can be able to share in a very open-minded kind of discussion on how we can better localize and set the agenda for institutions that are working within the context that we are in. And I think that is also tied with kind of the preconditions that come in on the table when we are discussing this. But then I would say I think the shift is good, the discussions are good, and while we know it takes time to be able to do things, and it is a moment for us to sit down back and reflect and see what is good for the local organization, for the international organization, for the funders, so that we come to the table when you have a kind of a mutual understanding and respect and value for one another. Thank you.
Yeah, I think very quickly, we as a foundation were very committed to working in a dignified way, dignifying our partners, both the think tanks we work with, but also government partners. Now we don't have all the answers at all. I think we have good intentions. We want to be as respectful as we can to minimize the burden on our partners, transfer as much agency as we can to our partners. We're a learning foundation. We have perspectives. we have a perspective, and we want to be thought partners to the organizations that we work with. And so we're looking forward to learning from the field, the people who do the hard work. It's not us. I think what we have is we have a checkbook that our president writes to organizations, and that's powerful. But it's actually, we're not the ones that are doing the hard work. I think you all are the ones that are doing the hard work. I would like to see as many organizations get involved in supporting governments to make better decisions, from sort of the bigger Nairobi-based entities to the Nakuru-based entities that are working more local and sort of have the understanding of the local context within that, that we have that diversity. And I think if we do that, then that will be a success for us.
Yeah, maybe just pick this from where Chris left, from a foundation perspective. Number one, we are committed to the localization agenda. Very difficult discussion, but we're committed to that. And yeah, an invitation as well. As a foundation, we have plans for the next few years. One is around building indigenous evaluation, reaching out to different people across the continent. We have a big initiative coming up, as well as investing in the young women and men. We just heard from a young impact associate who's been working with at the foundation, so inviting other actors as well, funders, to say, yeah, join us in this journey. I heard a proverb yesterday that one stick just smokes, doesn't burn, so really bring all the sticks. Let's move forward with the localization agenda. Thank you.
Andrea, just your closing on your side.
Thank you. I think for us from Southern Voice, we are at the time of trying to start testing some new things. So we are really eager to find partners, organizations that are in the same space of trying to do things differently in practice, so that there is that opportunity to learn. But then we need to take that step forward. So organizations that are are already thinking about this, are already thinking about how to position themselves differently, how to create these agendas that are grounded in local contexts, how to find new types of funding mechanisms and partnerships across the Global South that allows us to work together in different ways. So I think we are at that stage, and it would be great to connect with other organizations that are in that phase of testing the waters and trying new things. I think there is some appetite from some donors, so I think we can use that as a window of opportunity to test and learn and keep moving forward. Because I think, in addition to all the things that we've discussed, there's also we need to learn about the limitations and the restrictions within our own contexts, legal, administrative, taxation-wise, all these things, to actually make the bulk of funds being able to be managed from the Global South. So there's a lot of space to learn, and we are really looking forward to the opportunities to test to get that learning happening. Thanks.
Thank you so much. What we can see is the learning never ends, and I think from Africa Evidence Network perspective, you can see a lot of horizontal relationships, but also the vertical relationships, and we've seen the ones coming between government as well as the many different initiatives. I think that this is where I want to hand over back to Berta to say that we do want to be able to deepen these discussions and come up with some way of moving forward, noting that so much has been happening. Over to you, Berta.
Right. Thank you to the panel, first of all. It's been really insightful and engaging, and thank you to the audience. It seems like there is appetite to continue this discussion, so I really hope that you will come back and join us in around 25 minutes. The idea is that we'll split into groups. We have several funders in the room, and we're going to try and make sure that they are also distributed between the groups. I think that it's clear from the discussion that whilst there might be some different perspectives, there are some, I think, core, perhaps, actions and principles that there can be agreement around. And I think a goal so we will be asking you to write down the summary of your discussion, and this will be synthesized, and we'll sort of try and come up with a short list of actions that perhaps we'll ask people to also agree to publicly. And, you know, if we are many organizations that are behind some core principles, then we're stronger. So hoping to see you all back together after a bit of coffee.
You'll behave. Finished only 5 minutes late. Everyone.
Panicking and put to love. Only when collab I can know if I were. Tell me now. Love panicking know if I were. Panicking and put to love. Only when collab I can know if I were. Tell me now. Love panicking know if I were. Emi mi do te kute, nemi wa baby. Can we take attention to say Kumanga wali wonse chengamba Wali wenchi buzo bambi chembuza Why it's not a lose control every time that you come around Panicking and put love When you wake love I can't know if I were Tell me now Love panic can't know if I were Panicking and put to love When you wake love I can't know if I were Tell me now Love panic can't know if I were He said let me keep your secret, check. Deepest of my heart is the safest place. So baby, turn to me and say, hey. Girl, I love your body. I panic when I see your body. I admire my baby's body. Hey, yeah. Baby, when you turn up on me, baby, umutima kupa kukupanyo. You're the one that I keep for, baby. Everywhere you go, I go follow. Panicking and put to lie. But when cool love, I can't know if I were. Tell me now. Love panic and if I were. Panicking and put to lie. But when cool love, I can't know if I were. Tell me now. Love panic and know if I were. Sitting over and go to say, Ebila Eulange, on David and Yo Viola, Timutu Bambi, Omoe Nakafanani, Akobambi Alavenga Ko Viola, Benga Mumeme, Nange Mumenga Mumeme, Alina Kabiri Viola. Akayo yo bambi okoko sakayindo akalalo ko sweetie wenze jokira erinyalye okulyogera mpomelwa kozinde konungansani kozinda nungalirize obulire nti Bulaya abawala banje abalungi ekyo tekimutiisa Viola malaika wange mama Viola mwagala kamba Viola akumendika kubaga nange zendi mukomendo wesigwa la 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 they make it, my temperature go they rise. If you leave me, I go die. I swear, you are like the oxygen I need to survive. I'll be honest. Your love will be totally me. I'm so obsessed. I want to talk. Kuduro, your body they work on this thing. Kuduro, open and make us sing. Kuduro, give me love for one thing. You make a bad man sing.
Ladies and gentlemen, attention please. The kitchen is kindly... Ladies and gentlemen, attention please. May I please have your attention? Thank you. The kitchen is kindly requesting that we go down and have light refreshments as they need time to prepare for lunch that is going to be at 1 o'clock. So if we can please go down, have light refreshments. We have 2 serving stations outside so that they can have enough time to prepare for lunch. Thank you.
Sukali tai na kadalasini kwagalo kutuka kumwezi zikiri zambera sikali ngankukuma na kasale maidali chesi wanyikole risachi emisuweni nemekamulirako usiwa mulinga wechirisa akanyama kamyufu kuchoto kaliriro chusa wondia hamaso gani kukwe itukamisi wompita jakala tukati wenga yeze poitatia walivuga kakali nangediva kalia jakala tukati wenga
Okay. Ladies and gentlemen, apologies. The facilitator just informed me that you have unfortunately missed the refreshments time. So now the session is about to start in the next 2 minutes. You will then have lunch at 1 o'clock. Thank you.
So yeah, the African Population Research Center is a center that I know, and yeah. Haven't you finished? You should have finished. And
go into groups, as we mentioned, and have the time to both discuss and learn from each other. And we hope that you will also record some of what you are finding or agreeing in your discussions, and then hand your notes back to us afterwards, and then we'll try and do a synthesis of the feedback at the end. So there are 4 questions. Are there any funders in the room? If you can make yourselves known, or if you all know who you are, just make sure that you are not all on the same groups, because we'd like to spread you around. So I suggest that, and I would invite you to go into a group with, not necessarily just with people that you know. This is also a chance to interact with other people and do a quick round of introductions, and then nominate someone in the group to take notes. So we're allowed to move chairs around. This is not the best room for a workshop, but I think let's make it work. Right? 5 to 6 people. Yeah, I think that's a good number.
Really want to make this group, like give people 1, 2, 3, and then the number 1.
You want to do that?
More time for them. I will sit somewhere waiting for otherwise,
take control.
Thank you. Right, just to facilitate this, please, group number 1, those who want to be in group number 1 here, group number 2 in the middle, 3, 4, 5, 6. Now, how do we determine group number? Miss, would you mind please being number 1?
Number 1.
Thank you. How about you, number 2? Just say 2. You want to be in the same group. So your group is formed then. Group number 1. Group number 2, here, okay. If you think you are too many, please don't mind. Just start another group down here, number 3. Hi, Thomas.
How are you?
Very well, you? So group number 3, around Etienne, okay, very good. Number 6, around Sir. Yeah, group number 6 is here, very good. And you'll be the anchor for group number 5. Is that okay?
Okay.
Okay, group number 5, don't move. Oh. You are in the group number 5 now. Yes, group number 5. And group number 4, Candice, would you like to? Yes. So around Candice, please, from group number 4. 1. Etienne, group number 3, around you. Okay, I'll send you a few more group members. Thomas, how?
I'm well. We said with Chris from Hewlett.
From at 1. Yeah. I request Leo to reserve a table for us. And I'm going to confirm with today.
He was at the previous session, but I saw
this is a continuation.
I asked him to come back. It was a bit vague. His response to you was a bit vague also. So
I was in. I have
I just sent you one, but you can ignore it. I was just asking if he can.
Yeah, not yet. But I need to make sure that.
said two things that were interesting. One, we've done a lot of things. We've been successful in Anglophone Africa, but we have to remember about Francophone Africa and the importance of it. We also said we don't want to build just one or two giant think tanks, like so we have.
Okay. In about 3 minutes, we will start closing this session. I kindly request you to please start wrapping up. Thank you.
Right. So it's great to see that you're having very active conversations. Just to say that we're coming up to 1 o'clock and lunch. You are welcome to stay and discuss. You can keep hold of, most of the groups should have at least one blank sheet, so you can keep taking notes. We'd like to get the notes of the discussion so far, and then we'll try and bring it all together for a report back on Friday. And thank you all for joining.
start. I think we're already running 15 minutes late. I'm sure we've got an online audience that has been waiting for us, so we need to start. Okay. So this afternoon session, as you read, is called Valuing Evidence in EIDM Differently: Equity, Inclusion, and Trust. Yesterday, we started talking around these issues, and I raised some questions. We talked about how it is important to bring the different groups of people together. And the reason is that people have different ways of seeing any situation or interpreting. And it is important that when we bring different views, we also have a comprehensive understanding or analysis of evidence. And it must come in all forms of languages, all forms of communication besides what you and I know or the people in this room know. So it is important to just look at what are the lived experiences, that how are people practicing this. We've got 3 distinguished panelists that are with me here that will speak to some of the work that they're doing in the evidence space. And I would like to introduce these panelists, and they will each take a turn to just give us how they are really valuing evidence differently, looking at equity, inclusion, and trust. On my far right, we have Andile Madonsela. She's a highly motivated individual who is driven by the idea of social justice. She currently works as a managing researcher and gender and evidence lead at South African Center for Evidence, NPC. I will not read her bio in full because I know you all got the opportunity to do so. I also want to introduce I will start by introducing on my near right, Evelyn Jacob. She's a senior education officer with education.org. And she works closely with the chair for education, science, and policy, and the managing director of helping in building early impact and accelerate progress by driving development of best-in-class technical leadership to organizations, partners, and collaborators. On my left, we have Nainu Mirabella Yu. She's project manager with Effective Basic Services Africa, eBase. She's an award-winning evidence leader and a world pulse change maker, passionate about evidence-informed decision-making and inclusion of people living with disability in the evidence-based practice. And so here are my panelists. They'll each have an opportunity to speak, and then we'll have question and answer. I really believe what enriches the conversation is when we can weigh in. So please jot down your questions. We'll have all the panelists present, and then we will then come to you for questions and answer. And in fact, even examples that you may give around equity, inclusion, and trust. Andile, over to you.
Thank you so much for that very nice intro. Can I please have my slides? Thank you so much. So just as I have been introduced, hi everyone, my name is Andile Madonsela and I work as a gender and evidence lead at the South Africa Center for Evidence. And I'd like to tell you more about the Evidence Transformation Index that we have been working on, myself and Lawrence Mahlanzalanga. Let's see if this works. Oh, great. So basically, I'd like us to just go back to sort of some of the bakings around EIDM, right? So if we are all on the same page that the reason why we are even in this space is because we want to use evidence to implement more effective policies and interventions that are able to fight against poverty and inequality, right? But then the basis of that is that we are using the best available evidence. But then if these interventions and policies are aimed at the most marginalized people in our societies, it becomes important then that the EIDM process and everything that is also surrounding EIDM is also sort of sensitive to the needs of those who are marginalized in our societies. So I think there are 3 areas in which the EIDM process has to be sort of sensitive to gender equity and trust as well. So we have identified those 3 areas as firstly, the methods that are followed. So if we're looking at evidence, the methods that were followed, are they sensitive to gender equity and inclusion? But not only the methods, but also the evidence translation process as well has to be sensitive to gender equity and inclusion as well. But not only that, but also the decision-making process. So it's therefore important that we don't miss it at any point, right? Because if we are sensitive as far as methods are concerned, then we lose it maybe in the translation of the evidence, then we lose the whole focus. So it's very important that at all 3 levels, we continue to maintain that not only are policies and legislations and interventions evidence-informed, but to ensure that they are considerate of the needs that are of those who are most marginalized in our societies. So I think then we have been quite active in trying to find out how best we can assess the extent to which the evidence that we use to make recommendations and to create evidence maps and systematic reviews are sensitive to gender equity and trust. And then, so maybe the first one there is that we have used the 3IE equity coding tool to assess the extent to which the evidence that we use is sensitive to gender equity and inclusion. And then over the years, we have also incorporated a certain element, which is what we call the JESI. And the reason why we have it is because we produce a lot of evidence maps, right? If you don't know an evidence map, please come to the incubator hub. You'll see what an evidence map looks like. But an evidence map gives you a nice overview of the evidence base that you have, right? So I think we thought that it would be great when you open an evidence map, it does not only just tell you the quality of the evidence in that evidence map, but also the extent to which the evidence that you're looking at is sensitive to gender equity and inclusion. So I think we developed the JESI tool, which has tells us the extent to which the evidence is sensitive, considerate, or absent, right? So we rated studies as JESI sensitive if they looked at vulnerable communities or people. So if a study was focused on disabled people or displaced people or migrants, or people living with HIV, for example, that study would be coded as JESI sensitive, right? We would consider it as JESI sensitive. But then a study was coded as JESI considered if it actually, so as much as it maybe sampled maybe both men and women, people with disabilities and people without disabilities, in their analysis or in their methods, they were cognizant of that. So they were like, okay, this is the intervention that was done, and this is how the impact of the intervention on women versus the impact of the intervention on men. So as much as they did not only sample populations that are marginalized, they were quite aware to understand that chances are the impact on different populations would be different, right? And then studies were rated as JESI absent if they did not consider that. So if they just report on the impact, or everyone really loved this intervention and it was great, or oh no, this intervention was not really great, but it does not take into account the difference as far as populations are concerned. Right, so, but then if we have done these two, why then do we have this evidence transformation tool that I'm telling you about today? So the reason why we wanted to develop this tool is because we wanted a tool that really aligns with SA government's definition of what equity is or transformation is. So we wanted, because we work very closely with our national departments, so we wanted a tool that speaks to them. So when we say equity, we don't use our own standards or the standards that we are adopting from other studies, but we are using the very same frameworks that they are using on a day-to-day. So that's the reason why we took up the task of developing this specific tool. And we also wanted to apply this tool on policy-relevant evidence maps. If Promise Ndugu was here, he would tell you about sort of the work that we've done as far as policy-relevant evidence maps are concerned. So those are evidence maps that speak to existing policies or policies that would be developed. So we wanted a tool that will work with those. I don't think it's, okay, great. Did I move too much? Okay, so then what is this transformation index I'm speaking to? So it's a document that guides you on how then to assess the extent to which evidence is sensitive to equity, but looking at the definition of equity according to this framework. And what is that framework? So the framework is the broad-based Black economic empowerment. Those of you who are from South Africa, you know this already, but for everyone else, so this is a framework that was developed after we attained democracy. So South Africa was historically under apartheid, and that does mean that there was sort of a hierarchy which placed Black people at the bottom of the hierarchy, and sort of there was a few white people who had the means to participate in the economy of the country, and everyone else was excluded. So to make sure that we balance things out after attaining democracy, the framework was introduced. So the framework then therefore targets Black people, specifically women, youth, people with disabilities, and people that are living in rural / underdeveloped areas. So that's sort of the target of the framework, and that is sort of the very same framework that this tool is based on. Okay, so then when we are actually looking at this evidence, what are we considering? So the first thing is that, does the study sample Black people, right? So there is twofold. It's either you have sampled Black people only, or you sampled all populations, but then you disaggregated the data according to race, right? Or the impact of the intervention according to race. So same thing would apply to women, young people, unemployed people, persons with disability, people living in rural areas and underdeveloped areas, and then military veterans as well. Just to reiterate that the populations here, we got them from the framework. So we did not come up with these sort of target populations, but we got it from the framework itself, right? And then it also does give us a definition of what a Black person is, what a woman is, what a young person is. And then what then happens is that we scale that study, right? From 1 to 100. So we would look at, does it have Black people, does it have women, young people, unemployed people, and then there's like an overall score, right? So if you look at the far right, you can see that if a study sort of gets 0 to 19 points, then it's coded as transformation absent. And then if it's coded as, so if it's between 20 and 39, then it's transformation critical. And then 40 to 59 is transformation moderate. 60 to 79, transformation sensitive, and 80 to 100 is transformation focused. So I think there's also an important thing to note here at the bottom that a piece of evidence gets extra points for adopting equity sensitive research methods. So if they went above sampling and disaggregating the data and looking at the impact of this population versus the other population, then they get extra points for that. And then these overall points would therefore be what you see when you open a policy-relevant evidence map, right? So if a policymaker wants to make a decision, not only do they have sort of all the evidence in one place in the evidence map, but they can also see to what extent that piece of evidence is aligned with the very same framework that they work with every day. Okay, and then, so what's next, right? So the very important thing, important point to make here is that DNA, co-creation is part of our DNA. So we never sit down and develop things and we say, oh, okay, this is the truth and that's it. So we are very much focused on making sure that it's user focused. So our users would be the decision makers that we are targeting. So I think what is next currently is that we are planning to do consultations. We have done a few already. I've done 3 to hear from the decision makers and our national departments what their thoughts on this tool is and if it's applicable to their work, because it has to be relevant to them, because that's the whole point, right? And then we also want to speak to you, so I'm glad I'm here today. If I tell you about this transformation tool, what are your thoughts as well? So I think we are also planning to also consult with others within the evidence ecosystem to hear if I was developing an equity tool that speaks to policy relevant evidence maps, does this make sense to you, right? And then we also want to pilot this transformation tool. So we're going to try it out on some of the evidence maps that we have produced over the years and also the ones that we are busy working on to see sort of how it does in practice. Because sometimes you come up with an idea and it's really great, but when you have to actually apply it, you realize, okay, I think we might have missed some things here. So that is sort of something we want to do also. And then we also want to document lessons, you know, because there's a growing recognition of the importance of assessing the extent to which evidence is sensitive to gender. I know that Laura is doing her PhD and it's linked to this, and she told me that she found quite a lot of tools that are doing similar things, right? So it's very important that we continue then to document lessons that we get from this work so that if you are then developing your own, you are able to sort of learn from that. So that is also something that we want to get into. But otherwise, yes, that is the evidence transformation tool. Looking forward to getting your thoughts and your comments about this too. Thank you so much.
Thank you so much, Andile. And I would like to encourage you to just write your questions for Andile down, and then we'll have a discussion at the end. And I think for me, this is quite a very important tool, the Evidence Transformation Index, because it's actually relevant to the South African situation where it's based on BEE framework. So let's go to the next presenter. I will not attempt to summarize because I don't want to take time, and we'll have enough time to speak after our presenters have presented. Over to you, Evelyn.
Thank you very much. My name is Evelyn Jacob. I am Senior Education Officer at education.org, and I'm based in Nairobi. Today, I want to talk about democratization of evidence and our experience in looking at evidence in such a way that we want to see the utility of that evidence within the education space. May I have my presentation, please? And the first question that I asked myself when I was asked to speak about democratization of evidence was, why are we talking about democratization of evidence now?
So these are the wrong slides. We need the ones for Evelyn, education.org.
Anyhow, let's proceed. The slides will come later. Part of the reason why we are focusing on democratization of evidence, particularly in education, is because when you talk about education, just like health and like agriculture, it touches every family, okay? And so when we discuss issues around evidence, we are actually discussing issues that are likely to affect each and every family and actually every child. And so the tradition that has been in education is we have a lot of research. We are scholars. We have We have the knowledge, and there's plenty of research across the board. However, there are certain challenges, particularly that are pertinent to that sector, that we have observed, and we're trying to do something about it. One of those is that even though evidence is collected within, say for example, within Africa, they're usually reported with a lens that is not African, that is not contextual. And so when solutions are then developed as a result of that kind of evidence, we have a challenge, because then those solutions do not fit. They don't create a good fit for the needs of the society. The second thing, of course, has to do with the process of designing, the process of processing that research, and also of using. What we found out is that in education, policymakers do not always go to research journal, peer-reviewed journal sites to be able to access evidence. In Kenya, we work very closely. Our program is embedded within the ministry, so we work with colleagues from the ministry. We sit at the table and we ask ourselves, where do you go to when you are asked to develop a policy brief? And they said, I call the director at the county level, and they tell me, how many children are enrolled, and that is how I do my work. But that evidence is already available somewhere. But the culture is designed in such a way that policy making is not inherently, it does not inherently seek evidence. As educators, we want to use the wisdoms that we have. We believe that we know, and so we make our decisions based on what we believe is correct. The other thing, of course, has to do with how the system is aligned with the efforts that produce evidence. Usually, the permanent secretary for education in Kenya once told me that government does not do research. We only consume. But even that consumption, of course, is an issue. But the fact that government doesn't do research means that that responsibility is left to all of us here. Now, how do we link? First of all, how do we generate that evidence within the communities? Are we involving the communities? Do we have their voices? Do we amplify the voices of those communities? And does their opinion make its way into policy? The second level has to do with the evidence producers. There's a lot of research that is done locally by local people within the universities and so on that don't make it to the peer-reviewed journals. But it's good research that we can actually be able, has nuances and insights that can be used in education. So we are looking at all that, and our effort is an effort towards equity and democratization of evidence, which hopefully will then translate into democratization of education. My slide hasn't come, but we'll continue, no problem. So the next point that that I wanted to mention is, what are the challenges? In our reflections, the challenges that we know are prevent the bureaucrats from using evidence. And one of those is that whenever we produce evidence, we package it in a language that is not friendly. It's difficult, it's very complicated. And our reports are usually bulky because there is a format you have to follow, because this is research. You must have the theoretical framework, you must have this and that. And a policymaker who has to go for 3 meetings in a day does not have the time to be able to sit and go through that and decide what are the implications of what I have read. The other thing, of course, has to do with the the ability of policymakers to actually translate the evidence that is available into actionable points for policy and also for practice. And of course, there's the question of the research world prioritizes scientific research, and it prioritizes academic work than, say for example, action research by a teacher in a school and so on. So looking at all those challenges, we feel that because then policy is not necessarily always informed by evidence, and actually by and large it's really not informed by evidence, we feel that whatever references that the policymakers use creates marginalization, okay? Because you haven't had everybody's voice. We haven't had voices from even the marginalized communities and so on. And even if we have, we may not have translated those voices into actionable insights that can actually be able to be used in education. So then, what do we do therefore? At education.org, we are looking at two main pillars to be able to address the question of democratizing evidence. The first one is, as I said, we embed our work within the ministries of education, and so by doing that, we design certain activities that will help us to be able to strengthen the systems. It's not just about training specific people, but strengthening the system and helping to create a culture of evidence use. Because sometimes depending on who the partner is, the ministries of education can actually use evidence for that particular activity. And then for another activity, they don't do that. So what we are trying to do here is to work together and understand their needs and respond to those needs in a way that we are not prescribing, but we are sitting with them and we are supporting them to strengthen those systems. And so the system strengthening is the first pillar. The other pillar, of course, is to actually make available evidence to policymakers. And how do we do that? I want to use the example of our first product that we did during the time of COVID. At that time, in the example of Kenya, for example, there were questions around how do we recover, how do we help the children, how do we stem the learning loss? And the Ministry of Education had already allowed certain models of accelerated education in the marginalized community, in the arid areas where children are not able to access education in the traditional way, and also within the refugee communities. But then now here we were looking at a challenge that is affecting all children because learning loss was a real issue. And therefore the government was considering accelerated education and said, we have no guidance. We don't know what a good accelerated education program looks like. And so at education.org, what we did is we undertook a synthesis. We sourced for evidence across the board, both published and unpublished, both from practitioners and also from all evidence producers. And we received this huge number of studies and reports from different places. And so what we did is we synthesized that evidence and tried as much as possible to answer the question, so what? So we gleaned the actionable insights that the Ministry of Education, when they look at it, they say, okay, let us sit down and develop the policy that will guide accelerated education. So we disseminated very widely the product of that synthesis work, and we're very proud to say that it formed the basis for the accelerated education policy in Kenya, and now in Sierra Leone. My presentation had a very beautiful diagram that I wanted to show you, but unfortunately it didn't work. But I hope at some point, look for me, I can email that to you so you can be able to look at it. And so our journey then continues. The next step or the next activity that we're trying to do in this space and from experiences that we have had in trying to synthesize evidence is that gray literature in education is a very gray area, gray not in a good way. And so what we are trying to do is say, how do we support the evidence community to be able to decide how do you access and how do you identify gray literature in education? How do you access it? How do you categorize it? And how do you appraise it? So that is the work that we are currently doing. I'm not going to talk about it here because in the next presentation in the innovations room, I'm going to be specifically talking about that particular activity. But so here we are, that through synthesizing evidence and making sure that we have evidence available for policymakers, we want to make sure that we are simplifying the language that evidence producers use. We want to make sure that we are speaking the language of policymakers, and we are not giving them bulky work. We are giving them guidance. And by the way, we are not also prescribing to say, this is what works, this is what you ought to do. For Kenya, for example, there's a whole difference in the context that Kenya is and in the context that Sierra Leone is. So even though the synthesis is one, we have adapted what it means for Kenya and what it means for Sierra Leone. So I think up to that point, I want to thank you very much. And I'm so sorry that my presentation was not able to load. Thank you.
Thank you so much, Evelyn. And I think apologies for that, that your presentation was, but you really held it well without the, so it's good to internalize and know your work. So well done for that. So I think one of the things that I'm taking home is around democratization of evidence leads to democratization of education, and the idea about gray literature. And I'm just emphasizing that because I think it's a key issue that maybe if you want to know more, you can follow through to the next session. So our next presenter, Nainu, I've already introduced to those who are coming in, but you can look up your apps to know more about Nainu, who's from eBase. Over to you.
Good afternoon, everyone. Great. So today, through Ankini's story, I would like to share with you how we can, or we could make millions of young people with disabilities to prosper by valuing evidence differently. My name is Nainu, and I am a researcher at eBase Africa. I'm also an Africa evidence leader since 2021 and a World Post digital change maker since 2022. Okay. So in my plan, I'm going to show you the impact of our intervention, how we did it differently, and then I'm going to tweak your minds a little bit around questions like, is invited to the table, or is invited to dinner the same thing as invited to the table? And then we're going to walk around equity, inclusion, and trust, and how we are enhancing evidence use through our intervention, and what next. So starting with Ankini, let me tell you a little bit about Ankini. Ankini is a young boy, 8 years old. He has a disability and lives in the neighborhood in Bamenda, Cameroon, where I'm coming from. And when we met Ankini, he had a lot of unmet needs. His health needs were not met. He was not meeting hospital appointments regularly. He was not attending school regularly. He was isolated from the community. He didn't have friends. and his parents were also struggling with him because of his disability, and it looked like it was a burden to the household. And Ankini is just one of the children whom we worked with. We actually worked with 30 children with disability and their households and community. And the impact here is, the focus is on the quality, how we impacted on their health, education, livelihood, empowerment, and social well-being. So since the conference began, we have been talking a lot about policy and practice, but we have talked very little about population. By population here, I mean citizens, households, families, and communities. So in our interventions, we are asking questions like, what tools could work for people with disability? What formats are best for people with disability? What are existing structures that we can leverage on? And this led us to developing an evidence toolkit that brings research into the households of people with disability in consumable formats. This toolkit is called the eBase Family-Centered Evidence Toolkit for Disability. And we brought this through, we leveraged on community health workers and social workers to explore aspects of disability during their routine household visits so that they can bring research targeting health, education, social well-being, livelihood, and empowerment to the households of people with disability and have them and their families engage in these evidence recommendations to improve on their livelihoods. We looked at evidence databases if the resources on these databases are accessible to people with disability. You see a graph there. We see the blue. The blue stands for access to the website, and the orange stands for access to the resources. So the people with disability have some access to the website, but they have difficulties accessing the resources in the website. This means that we have actually invited the people with disability to dinner, but they are sitting away from the table. And we are eating at the table, right? That's why we titled this paper, Invited to Dinner, but Not to the Table, Web Content Accessibility Evaluation for People with Disability. This research paper has currently been accepted for publication in the Research for All journal. It will be published in the November edition. We did this research or this evaluation with researchers across Africa and the globe. So if you look further, we see that a lot of work has been done to produce research, but this population is left out. If you look at the graph to your left or to your right, it shows compliance to accessibility across all the resources following the Web Content Accessibility Guidelines. And if we take an example like alternate text, we see that it's as low as 20%. This means that someone who is blind can get access into the website, but will not be able to see or read the resources. And if you look at something like color, for example, it's totally blank. This means that someone who has like color blindness will not be able to consume anything on the website, even if they have accessed the database. So these are some of the challenges we're looking at because there has been a lot of talk about disability working groups, but the resources seem not to be accessible. In essence, accessibility has to be all or nothing. So how do we do it differently? We worked with the families and with the families building from the global agenda of nothing without us, nothing for us without us. So we started with conversations with people with disability, asking them questions like, what are your challenges, what are your experiences, what would you want to see to say that this works, this intervention works, how you want it brought to you, and how do you want it delivered. like that. We did this with them through through focus group discussions and stakeholder meetings with them. And we went further to synthesize the evidence. We appraised the recommendations. We reviewed the recommendations. We reviewed all of this with people with disability, the community health workers, and the Ministry of Health. And at the end of the day, we had this toolkit developed for disability that brings the research into the household. So in essence, this toolkit gathers research that has been synthesized in very digestible formats for people with disability, such that community health workers carry these tools and do household visits into the households of people with disability and give them these recommendations. So here, bringing in voice for people with disability, inclusion and equity. This graph here just show how the voices of people with disability were brought into the design of the intervention and through the process of the intervention. We used Max QDA to do this, to carry out this process. And in our intervention, we had some interesting results through education, health, social well-being, livelihood, and empowerment. This has also been developed into a paper titled Using an Innovative Family-Centered Evidence Toolkit to Improve the Livelihood of People with Disability in Bamenda, Cameroon, a mixed method study. This has also passed the first review in Frontiers, and we are currently working with the second reviewer, and the hope is that it will publish before the end of the year. So we see that we have quite some improvement in empowerment. This is because we incentivize the process. What do I mean? This means that when the community health workers bring the research into the households, they set a target for the family. And when you reach a certain score of 65 points and above, you are rewarded a seed fund to start off an income-generating activity of your choice that will support the unmet needs of the child with disability. For livelihood, we don't have so much of improvement there. This is because the seed fund was also small. The seed fund we're giving the families of children with disability is about $186. So livelihood there, we have just a little. And we see social well-being. Social well-being is quite an improvement. Social well-being is relative. For example, I would say that when I was growing up, I would wake up in the morning and walk like 2 kilometers to fetch water before I come and bathe and go to school. And when I return, I have to go fetch wood before I come. But in today's age, I wouldn't want my daughter to do that. It will look like, so it's relative. That's why we have those results like that. So valuing evidence in EIDM differently. This is how we had incentivized the process. The peak on the left shows the evidence indicators, how the families complied and got scores. So those are scores. At the end of the day, we are going to tally them and reward them with a seed fund of 186. So Ankini's family followed this approach with us, and we also encourage what we call the Njangi approach. This is an African approach where proceeds from your business are saved so that they can be reinvested, and through this business model, other people or other families of people with disability can be brought in to the process. And we also follow a model which we call the Joseph's Coat of Many Colors phenomenon. This means that the proceeds of the income generating activity are not focused only on the child with disability, but we have this model where we advise families on how to spend the income gotten from the businesses. For example, some go for saving, some go for acquiring insurance premium, some go for supporting family family needs. Some go for for buying a gift for the child with disability and their siblings, so that all the attention will not be focused on the child with disability. And at the end of the day, what happened to Joseph in the Bible will not happen to the child with disability. We all know about the story of Joseph, right? So, valuing evidence in EIDM differently, including Ankini's family in the design of this intervention, enables inclusion, it promotes equity, and it builds trust. These are populations that are likely to be left behind the evidence stream. We are likely to do things for them and not with them. So, including existing structures like community health workers and social workers as well, increased trust. These are people that work with them on a daily basis. They do home visits. And it also facilitates government ownership and systematization. And it ensures sustainability, because the community health workers will continue working even if our own intervention ends, which we don't hope that it ends. So we move to perspective. I had an opportunity to do a cultural exchange in Holland, where I met a couple of people, and we did some exchanges, built more partnerships, and we're looking forward to doing more cultural exchanges. And one of the things that our project or our intervention promotes or encouraging is building a my own identity, giving the person with disability a my own identity. This is through the disability card. The disability card is like an identity card for the children with disability who otherwise did not have a disability card, did not have birth certificates, and were left behind and were excluded from basic services, because if you don't have a birth certificate in Cameroon, if you don't have an ID card, you cannot access basic services. So one of the key things we're working on is having people with disability acquire disability card so that they have their my own identity. And also, during one of our discussions with the families with disability, one of them said they just want to live the good life. So working on the good life, solidarity fund, and business model. Here is a business plan developed by one of the families of the children with disability. When they got when they scored 65 points, of course, so you prepare a business plan and we evaluate it and we fund your business. And this here is a call to action for all editors to insist on accessibility check for all articles. And it's also an opportunity for us to lead. So you have to check that when you do your publication, before it gets there, you have done all accessibility check.
Maybe one more minute.
And a bigger trial to assert and facilitate intervention. By way of conclusion, I'd like to encourage everyone in the room here that it is in our hands to build the Africa we want, that leaves no one behind the evidence-informed decision-making train, including people with disability. Our approach brokers evidence to help people with disability live a more decent life with better access to basic services, a sense of belonging, entitlement, decent life, and fulfilling work. Thank you very much, and I share cola nuts with you.
Thank you, Nainu. I think the Njanji and the Joseph, the coat of many colors caught my attention, and I'm glad you explained how that came about. So thank you so much. So we've had 3 really very different cases looking at how we can value evidence differently, looking at equity, inclusion, and trust. And so now I want to open up for questions. Do we have any questions, comments? I'm hoping that you are taking down any questions that you may have. And I want to start with maybe 2 or 3 here and then online to ask Charity if you have any questions online. Do we have somebody who can help us with the mic? There's a hand right in front here.
Thank you, colleagues. Thank you, presenters, for this insightful presentation that you've just made. Mine is an observation, and I also have a question embedded in that observation. Yes, we can talk of equality, inclusion, trust, and not practicing it. We can develop tools. This will not work. It will actually work in vain. What am I saying? Yes, we might be valuing the equality, inclusion, the trust, but in theory. But are we practicing it? We can come up with a panacea of interventions that are meaningless. As champions of evaluations or voice of the voiceless, we will not be able to achieve SDG 10 that talks of reduced inequalities. Because it's actually the mantra says, leave no one and leave no one behind. And we also won't be able to achieve our Agenda 2063. As we go back home, as champions of evaluation, let's advocate for the inclusion of the PWD, people with disability, at such conferences. What am I saying? Yes, we are here. We are talking on their behalf. Where are they? Are they here? No. We are talking on their behalf. I think they can also speak. So let's include them here. I think you actually said something that touched my heart, because my heart bleeds when you talk of things to do with PWD. What we have actually done is we have invited them to dinner, but we have not invited them to the table. So this is the table that we should invite them to, so that they also take active participation in this. I submit. Thank you. Sorry, I forgot to introduce myself. I am Caroline Makuvire, Director Evaluation and Learning with the Office of the President and Cabinet, Zimbabwe. Thank you.
Thanks, Caroline. That's a great challenge, and I'll let comments later, but any other questions from the room? Comments, questions? Thanks, JP.
Thank you so much. I do appreciate what colleagues are sharing. It's insightful, and as in some context of the context that they say, a luta continua. This is the beginning, not the end. There might be gaps, and I think together we'll keep filling them. The question on evidence transformation index, looking at the criteria, we have got Black people. What about a country like mine, where we are all Black? Just try to put that in the context where in some other countries they might have only Black people. Language use or language simplification. I like this. And the challenge to all of us here is, when you are talking about scientific evidence, what do we mean? We are talking about the p-values, confidence levels. How are we going to translate that into my mother tongue's language, the one she can identify with and understand where there is change or no change? That's a challenge to us again. And lastly, I do really appreciate the Njangi approach. I wish even all these tools, we are sitting with the Ankini family to co-create the tools, to co-create index. Can we do it? And I think, yes, we can. Thank you.
Thank you for that. We've got another question on my right, in the middle there.
Thank you to the panelists. I actually have a question for you, Ndile. I mean, recently I was working on a systematic review about gender equality and women's empowerment. And what I noted is sometimes the discrepancy between what the research claim they will do as an approach and what they actually end up doing. And a typical example that I have that frustrated me a lot when I was doing the screening is studies that say we are taking a gender sensitive approach, and the only thing we see is actually I've disaggregated 1 or 2 outcomes between men and women. And when you look at the actual methodology of the research, they conduct the interview on women's empowerment and gender equality in a fragile context by interviewing the wife and the husband at the same time in the same room and asking the wife, are you victim of any intimate partner violence? So that's the kind of frustration that I encounter sometimes. And I mean, I'm not a specialist at all about all the topics that we talked about today on disability, but I assume this is maybe a challenge that we encounter sometimes in research. So I wanted to hear a bit about, as you worked on this project, what was your perspective on this between what is claimed by the research as the approach and what is actually being done? Is it an issue in the methodology developed? Is it kind of a buzzword now to say we're inclusive and we take this into account? Or is there anything we can do to avoid this kind of issues? But thank you all.
Thank you so much. So over to you, panelists. If you can take just a minute each to give your response, and then we'll take another round of questions, hopefully from online. Our time is almost up, but we'll indulge ourselves another 5 minutes.
Okay, thank you so much for the questions. I think I will start with your question around Black people. So I think also just to reiterate that this is based on a framework that was developed to sort of address past injustices. So for the South African context, Black people were excluded from participating in the economy of the country. So hence, any transformation framework or transformation tool, therefore, is usually aimed at Black people. But if it's only Black people in your country, then how do you define transformation in that context, right? So what are some of the tools that you have? What are some of the frameworks that you follow as far as trying to balance things out, sort of balance the equilibrium or have that sort of balance between the different types of populations that exist. So I think to answer just that question. And then ATN, I think, so that remains an issue, I think, in the evidence world. I think we took time, so I worked on a project where we were looking at birth registration in Mozambique, Nigeria, and Cote d'Ivoire. And we did the very same exercise of trying to find the extent to which the evidence is sensitive to gender and equity. And that is one of the issues that we came across, right? So at first glance, because sometimes we would then, when we come across a study, the first thing you do is to search for keywords, right? So you search for a keyword and you say equity, and it comes up and you're like, yes, finally, someone actually did it. But when you actually take the time to try and read the study, you realize, okay, they had great ambitions, or maybe they used the word there on the abstract to look very nice. But when you assess the study and you read further, you realize that, no, actually they did not maintain what they had planned out to do. So I think those are some of the issues that we come across. And I think it's probably a call to researchers that are doing the actual sort of research work of collecting data and analyzing data and to say, if you have those great ambitions of being quite sensitive to equity and inclusion, maintain that as well as you analyze, as you actually go on the ground and report on these things, so that it's sort of not a thing where you throw so that you look nice, you throw it there on the abstract so that I'm like, oh, nice. But then when I read the paper, I'm like, oh no, right? So I think it's a challenge. I don't think we have figured out a way around some of these issues. It's a work in progress. Unfortunately, in 2023, some of these things are still a work in progress, which is quite disappointing. Over to you, Evelyn.
Thank you very much. I just want to speak to the question of translating evidence and the language that we use. Quite obviously, I think we all are in agreement that sometimes how we package research as academicians and also as practitioners excludes other populations, whether it is communities that we work in or it is policymakers. So in our case, in education, where we were specifically focusing on supporting policy, we feel very strongly that we not only just need to simplify the language, but also use the language that makes sense to policymakers. And that's really part of what we are considering as an appraisal criteria for grey literature as well. And so it's such an important and very big issue when it comes to actually translating research into practice or into policy. So yes, I agree with you that language is very critical.
Great. Nainu, if I can ask you to just focus on the question that Caroline or her reactions that she gave on people living with disability.
Oh, I think she gave a very nice comment on the invite. We are in the dinner, but the people with disability are not here. So I just want to say that the Evidence 2023 made available the opportunity for everyone to be at the dinner. Sometimes it's challenging to get everyone at the dinner table, like this conference. So you can only as much as bring the invitation, make it accessible, but if someone is not willing to be at the dinner, we can't force them to be on the table.
Thanks for that. Charity, do you have any questions from online audience? From yesterday? Okay, come over. Let's hear the questions.
Afternoon, everyone. Hello, everyone. Okay, that's better. So we had some questions and comments for Adeline for your presentation yesterday. So Nkululeko said, amazing presentation. He loved the valuing of evidence differently, which is actually what we are talking about today. And he said the decoloniality of evidence sounds much like doing engine repairs on a car that is well in motion. Are there any ways to make it easier on everyone in the ecosystem? Then he said, my concern is that if you embrace the change, you may get locked out because of the status quo and all the barriers. Should I read all of them? 3, okay. Then there was another question from Ian Hopwood. He said, can we think of ways that traditional knowledge systems are changing and adapting to face new challenges in African societies that are changing so rapidly? Then the last one that I'll pick is from Carol Mukira. So she said, interesting thoughts there on decoloniality of evidence, the need to recognize the diversity of indigenous knowledge systems, values, and cultures as we look at the entire knowledge production and evidence synthesis process. Or it was more of a comment. Yeah, thank you.
Thanks for that. And I also open for you to answer some of these questions since you're also tackling the same topic. I think the idea about decoloniality of evidence, like fixing a car that is in motion and something like you may be closed out, it's because we don't know who we are, we're not sure about ourselves. We are also need to start changing our own mindsets, because it's almost like, okay, if I take this stance, maybe the funders will not give me money, And we actually experienced that when I was AFRIA president, that you talk about certain subject matters, people are not going to give you money, but you need to know why you're doing it. And that this is a long game. It's not a short-term thing. It's a long game. And now everybody's talking about the things that we were talking about from 2007. Yeah? So we started the discussions in 2007, started by the late Suli Gariba and also Professor Zenda Ophir. But now everybody's talking about decolonizing evaluation, decolonizing evidence, and somebody spoke at a conference I was at. They said it's not really, you can't undo what was done. You actually need to transform the whole ecosystem. Yeah? We need to transform the whole ecosystem. So we might want to stop the car and really maybe change the engine so that we can get to where we want. That's my response. And I think I'll just comment on Ian's thinking around are there ways that the local knowledges are transforming as we move around with all the changes? Oh, definitely there has been impact through globalization, and some of the traditions are being transformed. But sometimes it's in a not such a good way because we forget our old ways of doing things. But we know that the world is changing, and it's important to realize that we cannot be living in isolation, but we need to ensure that we don't forget where we came from. I think yesterday I spoke about history, that history is so important, where we came from, because the things that worked. I'm just talking about, when we look at climate change and the way the African people were living in harmony with the environment. What happened to all that? Why are we not doing that right now? It's because we've got so many ideas coming in, telling us this is the way you should do things, and then we just throw away our old ways of doing things. And any other comments or questions that have been sparked by the questions? Okay, if none, I'll give you just one last closing sort of remark. So what? After all this, what are we going to do? Why is it important? What are your closing remarks? Just short and to the point, please.
Okay, I was just checking the mic. So I think it continues to be quite important for us to assess the extent to which the evidence that we use to inform policies and interventions is sensitive to gender and equity. So one of the points that were made is that these people are not here. So I think one bridging gap, it's not the ultimate answer, but sort of one way we can bridge that is that we make sure that the evidence that we use has those people represented. So I feel like it continues to be quite important that we continue to advocate for the importance of gender-informed policies as well, equity-informed policies, not just evidence. So when we constantly talk about evidence, can we be also aware the extent to which this evidence is gender-sensitive, equity-sensitive, and the element of trust as well? Thank you.
I think that as evidence community, it's very important for us to understand that our work would be meaningless if we don't understand the needs that exist within the areas that we work in. We may have very interesting topics that we want to study and we want to research on or we want to synthesize, but unless we sit around the table and co-create and really design and understand the problem together with the policymakers or the communities that we work in, our work will remain to be just a very nice thing to see and read, but doesn't really have an impact. So for us to have an impact, we really must agree together with the people that we work with what the problem is, so that when we come up with a solution, it is also accepted.
Okay, I'd like to encourage everyone here today, all of us researchers, practitioners, whatever capacity we are in, at every one point, we have to understand that the essence of generating, synthesizing, or whatever we're doing, the evidence is for it to impact lives, is for it to be used. So when we are generating, synthesizing, or practicing, we should all endeavor to ask ourselves, how will this impact the life of a person with disability? How can I include a person with disability on board? What are the challenges? How do I overcome it so that they are not left behind the evidence-based practice stream? And that way, we are moving towards the 2030 and 2063 agenda. Thank you.
So thank you so much, everyone. Sorry we ran about 10 minutes late. And I think the next session is at 3:15. It says day 2 photo shoot. So just look at your agenda, and it's supposed to take place in plenary, is it? Okay. All right, thank you.
to our final session of this afternoon. I think a few people are still trickling in, but we'd like to get started. If there are any economists in the room, you should think about Say's law right now. No one's laughing, so you must be all other disciplines. Say's law is that supply creates its own demand. So as we start to reflect on evidence and the use of evidence in government, I think the demand will come. So we're going to get started. My name is Thomas Kelly. I'm from 3IE, and I will be the moderator for this session today. This session today is about responsive evidence services. If you were here for the last session before the break, before we went down and take a photo, the very last comment by the very last speaker of the last session was that we should all stay focused on the fact that evidence and everything we do around evidence is for its use. The focus needs to be on its use. And we have joining us today some of the most important people in helping bring together the evidence with its use. We have quite a clever and well thought out panel that the African Evidence Network has put together, because they've brought here today 3 pairs of evidence service providers with policymakers. So we have with us today a pair from here, from Uganda, a pair from West Africa, and a pair from South Africa. And we're going to hear from each of these pairs about their experience with this idea of responsive evidence services. So again, back to this notion of being responsive and the use, and hopefully a bit of the thinking about supply also creating its own demand. So we'll hear from each of these pairs for about 10 minutes or so, and then we will open it up to questions from people here in the plenary and online, and we'll see how long we go. But eventually, at the other end of this conversation, we will have a reception downstairs as well. So let me begin by introducing our panelists. From Uganda, we have Mr. Timothy Lubanga from the Office of the Prime Minister, and Ishmael Kawuya, a research scientist and coordinator from the Center for Rapid Evidence Synthesis. From West Africa, we have Mr. Ulu Clement Sikongo from the West African Economic and Monetary Union, and we have Deo Gracias Undolo from 3IE. And from South Africa, we have Harsha Dayal, Director of Research and Knowledge Management at the Department of Planning and Monitoring and Evaluation, and Laurence Malanga Langer, Executive Director of SACE, the South African Center for Evidence. So we're going to begin with Uganda, our hosts here for this conference. And one of the things we have heard throughout the first day and a half, or almost 2 full complete days, is the importance of trust, the importance of relationships, the importance of proximity, or being local, and the importance of being timely. So as we're listening to our 3 sets of colleagues, I hope we can all be listening for those things. And if you don't intend to speak about them in your first go-round, let's definitely come back to them in the question and answer session. Okay, so Ishmael, I think you're going to kick us off.
All right, thank you, Kelly. I hope by the time I'm done, you'll all be awake. I understand it's such a difficult time to be in a session right now. But I'll start off from the last phrase that Kelly talked about, evidence being timely. When we talk about evidence being responsive to policymakers, I think one of the things that has come out strongly in this conference so far is evidence being timely. But what does it mean? And my colleagues have talked about the Center for Rapid Evidence Synthesis doing the rapid response service. And one of the questions that has been coming up repeatedly is, what does rapid mean? I mean, it could be just a pedantic word to say rapid, but in our sense, rapid is rapid. You have to be responsive at the time the policymaker actually needs that evidence. That goes from about just probably a few hours to 28 days as we define it at acres, and that's within the rapid response service. That means when Timothy calls on us and asks for support, that he needs evidence summary, and he says, I have about 2 weeks to prepare for this meeting, then we probably have 10 days because he has to prepare for the meeting. That's what it means. If he calls and says we have 72 hours, that means you probably have 48 hours to prepare. And this is something that we don't just talk about, it's actually what we do. If that's what you need, then you have to make it happen. How do you make it happen? We have the skills, the people, the process experts to actually get it happen. Then within that, it doesn't just come up automatically. And as everyone has talked about relationships, this process of knowledge brokering, rapid response service is really about relationships. And through that, that's when you define what evidence being relevant. Because for it to be responsive, it has to be relevant to the needs. And if you don't understand where the policymaker is coming from, it may not just be the policy, the topical issue he has asked. It's about understanding the environment within which he's operating. If he's going to have a discussion at the cabinet meeting, how you frame your rapid response brief is important, because he's going to go with this brief. You want to help him be confident in it. If you don't summarize it in a way that is going to help him frame in this kind of conversations that he's going to have, then you may just as well keep it to yourself if you keep those scientific jargons to it. Then the other part that I'm just going to talk about before Timothy comes in is, of course, it has to be the best available. And as many in the room are probably methods, geeks, a lot has to go into the synthesis. But what does that mean? What kind of evidence are you bringing to the table? And where is it from? So a number of times we get questions where you have to go back and talk to the citizens, get their lived experience about that kind of evidence. So it being contextualized is just as well as important. So when we talk about the best available, you're really thinking about it not just being of the quality that it's necessary, but it has to be of the quantity, and it has to be contextualized to his needs. So just stop there for now. Thank you.
Do I go right away? Okay. So thank you, and good afternoon to you all. So what I'm going to do is to share from a policy maker, as they call us. I mean, everybody is a policy maker, actually. It's not just the people in government. But I'm going to share from our own experience here, government engaging with ECAS as an institution and other partners. And this is fresh. My experience is going to be very fresh for two reasons. One, for some reason, the organizers of the Africa Evidence Network evidence event this year decided to make it coincide with the day when we are doing our government performance review. So it couldn't have come at a better time. Yesterday we had the whole of cabinet and the most senior policymakers in government reviewing the performance of government in the last financial year. And for me, there are issues that came out of that review in terms of how much we generate and use evidence for planning and budgeting which I think is relevant for this discussion. So that's the number one reason why it is fresh. Number two, Uganda has a national development plan. We are now in our third phase. And that national development plan is halfway. We are halfway its implementation. We just completed the midterm review of the plan. And during the midterm review, we found that for all the outcomes in the plan, the outputs that are supposed to be delivered by the different government ministries, halfway, 56% of those outputs, we were not able to assess them at midterm review because of lack of data, because we were not tracking them. And that is a big, 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 big problem. So it was very difficult to fully understand the extent of implementation of the plan halfway its implementation. Now, as you can see, there are issues there around how much we are consuming evidence, how much we are relating between the people who should use the evidence and the people. And we are not short of research. We are not short of research in this country. We are competing very, very favorably. Actually, in the continent, I think South Africa and a couple of other countries are ahead of us, but we are right up there in terms of generation availability of research and even development of the research from fraternity. And so we're in health, in some of the areas we are actually right amongst the leading. So the question then is, why is there such a dire underutilization of evidence in planning and budgeting? And there are many reasons. I'm not going to bore us. I think over the 2 days, we have heard a lot about evidence should be accessible, evidence should be timely, it should be in the format that is consumable, because you can have the evidence, but the policymaker that needs to use it actually is unable to consume it, or maybe it is not disaggregated enough to enable decision making. The point I'm going to speak to more is around knowledge of its existence. So my preamble examples of the two events, one of the issues that was actually surprising is that many times the policymaker does not even know that the evidence is there, is available, and where it should get it. And then when they know about the evidence, there are many other factors that limit their access to this evidence. Let me give an example here of how one of the government departments that has worked with the ECAs has been able to benefit. And this is an example I just learned of last week. So last week we had an event with the ECAs, and we were sharing experiences and discussing how can we strengthen the linkage between this evidence generator and evidence user. And we had a testimony from the Ministry of Education. So at some point, a couple of years ago, there were a number of media reports about indiscipline of teachers, okay? So the national dailies would run a story, a teacher in school X has embezzled school fees for the children, and the children were not able to register for exams. Another day, an alarming story about how a teacher has abused a parent. Another day, a story about a teacher defiling pupils, defiling the children that they are responsible for teaching. And so the Ministry of Education got concerned and said, this amount of negative publicity is too much, and we are not going to be able to manage. So the question was, what can we do? The issue also reached cabinet, and there was a quick directive that the Minister of Education should respond in Parliament. What is the ministry doing? What is the policy framework for governing the conduct of teachers? And so the teaching is called the Education Service Commission. The Education Service Commission was given a task to provide a comprehensive paper that is going to highlight the policy reforms that government is going to implement to address the issue. So, and they were given a short time, within a month, okay? So the commission was stuck. How do we do this? We need to study the problem. We need to look at all the issues across the country. We need to consult widely and come up with proper recommendations. So for some reason, the Education Service Commission was in touch with ECAS. Now, ECAS has a pool of researchers with the skills and capabilities of, looking at the evidence that is available quickly and packaging it to inform policy. And just by that, they contacted ECAS as an institution, and they were able to, within a very short time, within a day actually, they were able to put together to look at what is available, what evidence is available, what is the scope of the problem, what solutions have worked elsewhere, and they were able to advise the ministry. And within 2 weeks, the ministry was able to respond to this. Now, there are many cases of such problematic service delivery issues which can never be addressed because the responsible policymaker does not know where to go, does not have the capacity to do enough analytical research work to get the evidence to inform a quick decision, does not know even of the availability or the presence of ECAS and similar institutions. And this can be broadened further. So the point about bridging the gap between the policymaker and the evidence generator is quite important. I think I should stop there, and I thought that I should just share that experience to elaborate how we have been able to promote it with ECAS. Thank you very much.
This is a truly excellent example. Ishmael started out by talking about the importance of relationships for knowing what's relevant. And your example really gives a good sense of the importance of that pre-existing relationship between your colleagues in education and ACRES. He also talked about quality of evidence, being timely, how to frame things. And as you talked through your anecdote, we really heard echoes of that mental framework that Ishmael gave us. Really an excellent example. Thank you, Timothy. Okay, let us move next to West Africa. And Deo, I think you're going to kick us off, yes? Okay, thanks.
Thank you very much. Hi, everyone. I'm Deo, Senior Evaluation Specialist at the International Institute for Impact Evaluation, and currently the head of our regional office, the Secretariat of the West African Capacity Building and Impact Evaluation Program, working with 8 Francophone countries in the West African region. And I guess from that presentation, you understand why it matters for me to share the experience we have in that part of the continent with respect to evidence synthesis. And I like your word of mental framework. The mental framework I often use to approach this is about having a market where demand and supply need to meet. But in our world, it's not enough to have demand and supply meet. It's quite important to make sure that we have mechanisms to track consumption of whatever product is generated. So speaking about those 3 pillars, in the WASI program, we've developed what is called a help desk. And our help desk, the way it works is to be able to react as quickly as possible to demand coming from decision makers, coming from policy makers, coming from researchers also, in terms of existing evidence that can be synthesized and given to them. But what we realize is that even though we created the help desk, people would not come right away. So it's quite important to sort of advertise, be active, proactive about letting them knowing about the product and making sure that the product removes some of their pains. And one of the most important pain that we've identified in this process is being timely. one of the most critical challenges of researchers is that the requirement, the technical requirements sometimes make us think that we have plenty of time. But if the use of evidence is really the end game, we need to be sensitive to time and find alternative approaches that do not compromise quality of evidence, but still addresses the needs of policymakers, which is an approach that we've used through the help desk. And eventually, we got our very first request coming from the government of Benin. That was about the impact, the possible effect of vocational training as a new way to invest into education in order to improve employment, youth employment in particular. So we've used the existing evidence to put together the evidence synthesis and share that with the government. It went quite a long way, not because after handing it over, we stood back. We've developed a mechanism to follow up with them and be also patient with them, organize workshops where we present not only to the high level decision-making body, but also with other staff that are intermediary between researchers and the key decision makers. That's one aspect. But in this whole model, the way I see it is that at some point, we need to make sure that while we supply the market, we will not be able to sustain the demand effort going after them each and every time. What we want is at some point, they start feeling the need to access evidence. And we started this experience back in 2019. Can you imagine that after almost 4 years, we're still around, pushing them, reminding them, organizing workshops at conferences, trying to harvest questions that we can address 4 years. So being persistent matters a lot. And after 4 years, now we make less effort because they know us. They know that we're around for questions that can help them do better the job that they are paid for. And hopefully, after 5 years, maybe 10, the demand will now come to us and we will feel more comfortable. That's where I have a call for anyone working in this field, anyone funding activities, to remember that it's not a matter of 2 years of investment, 3 years of investment. If we were to have system transformation, government transformation, it's a long-term game, and we should be prepared for that. To finish on this first round, partnership matters a lot. Partnership matters in the sense that, at 3IE, within the WASI program, we thought it's important not just to be researchers. It's important to have research mediators. And I myself, I see the work I do as a work of a research mediator, someone who understands the world of researchers, the importance of method and quality of evidence, but who also can interact, engage with decision makers, knowing that the decision-making equation is not made essentially of evidence. They are, evidence the way we define it. No, they have other types of evidence that needs to be factored in order for them to make the ultimate decision. How do we then work with those constraints and achieve whatever we want to achieve? And that's where we found one of our key partners, the West African Economic and Monetary Union Commission, represented here by Mr. Wolo, who plays a key role in determining the regional policies. So working with such a partner is an asset, and strategically it matters not to walk alone the distance we're talking about. That's at the end of the day our policymakers will be using evidence that are high quality evidence and demand evidence in order to make the market work efficiently. So essentially, Thomas, that's what I would like to share and hand it over to Mr. Clément. Mr. Clément is very comfortable in speaking French, so I think his presentation would be in French. I'll be around to support translation, and anyone else in the public is welcome. Thank you.
Good afternoon, everybody. As Deo says, my presentation will be in French. Alors, je suis évaluateur senior à la commission de l'UEMOA, au cabinet du président de la commission de l'UEMOA, où je suis conseiller technique en matière d'évaluation. Ma présentation va porter sur 3 points. Alors, d'abord, une présentation rapide de l'UEMOA. Ensuite, la fonction d'évaluation au sein de l'UEMOA en termes de production de données probantes. Et finalement, l'utilisation des données probantes pour la prise de décision. Alors, en termes de présentation, l'UEMOA est une organisation sous-régionale qui couvre 8 pays de l'Afrique de l'Ouest, avec une superficie d'environ 3 500 000 km² et 120 millions d'habitants dans ces 8 pays. L'UEMOA est donc l'organe exécutif de l'Union. Je vais donc vous présenter les objectifs de l'UEMOA. C'est donc de renforcer la compétitivité des économies de la sous-région, la convergence des performances en matière de politique économique des 8 pays membres. Nous avons également pour objectif de créer un marché commun entre les différents pays, de coordonner les politiques sectorielles nationales et d'harmoniser les législations nationales également pour avoir un espace homogène. En termes d'architecture institutionnelle, l'UEMOA a des organes de direction, notamment la conférence des chefs d'État et de gouvernement, le Conseil des ministres des États membres et la Commission que je représente ici. Nous avons les organes de contrôle, comme la Cour de justice de l'Union, la Cour des comptes, le Comité interparlementaire, qui est une sorte de parlement communautaire. Nous avons des institutions spécialisées comme la Banque centrale de l'Afrique de l'Ouest et la Banque ouest-africaine de développement. Nous avons également des organes consultatifs comme la Chambre consulaire régionale, le Comité du travail et du dialogue social et le Comité du contrôle parlementaire qui réunit les territoires. La commission donc, que je représente est l'organe exécutif. Alors, nous avons donc plusieurs missions que j'ai déjà évoquées. Alors, je vais aller un peu rapidement pour dire que nous avons, en tant que commission, le rôle de mettre en place des politiques sectorielles et communautaires qui impactent la vie de 120 millions d'habitants de la région. Nous avons des politiques communes, des politiques sectorielles qui sont déterminées par le traité fondateur de l'Union. Vous avez ici la liste de 15 politiques que nous avons, des politiques sur la convergence économique, sur la politique commerciale commune, des politiques en matière d'aménagement des territoires, de transport, de politique agricole, de politique industrielle commune, etc. Nous avons donc 15 politiques que nous mettons en œuvre pour lesquelles nous avons besoin de données probantes pour prendre des décisions, comme je l'ai dit, qui impactent la vie de près de 100 millions d'habitants. Alors, pour avoir donc accès à ces données probantes, nous avons donc bien conscience de l'intérêt de réaliser des évaluations de politiques et de programmes que nous considérons comme étant essentielles puisque nous sommes confrontés à des exigences de bonne gouvernance, des politiques et programmes communautaires, des exigences de redevabilité également à l'endroit des organisations de la société civile, des acteurs non étatiques et des partenaires. Nous avons également des exigences de résultats en matière d'intégration régionale. Et tout cela vient donc accroître la demande de données probantes pour la prise de décisions. Alors, pour faire face à cela, nous avons donc mis en place une direction rattachée au cabinet du président qui a donc pour mission de consolider l'efficacité des services de la Commission et de développer la redevabilité dans le dialogue avec les partenaires. Alors, cette direction donc, a été mise en place pour, dans le cadre de la gestion axée sur les résultats que nous avons adopté depuis 2011. Alors, je vais aller rapidement. Alors, pour donc, développer donc, les données probantes, nous avons besoin donc, de l'accompagnement des partenaires. Donc, nous avons notamment eu des relations avec WASI, représenté ici par TDO. Mais déjà en 2017, nous avons signé un mémorandum d'entente avec 3IE pour nous appuyer en termes de production de données probantes. Nous espérons que ces partenariats vont être mis en exergue très rapidement parce que, comme je l'ai dit, nous avons 15 programmes pour lesquels nous avons besoin de données probantes. Nous avons déjà réalisé des évaluations sur la politique agricole de l'Union, sur la politique industrielle, etc. Le WASI et 3IE nous ont accompagnés récemment sur l'évaluation du programme spécial de sécurité alimentaire pour lequel nous avons également des données probantes. Alors, nous sommes ici essentiellement en tant que demandeurs de données probantes, pas en tant que producteurs, parce que nous n'avons pas toutes les compétences internes. Donc, pour mener les études évaluatives qui vont aboutir à des données probantes. Donc, nous développons des partenariats. Nous sommes preneurs de tous les partenariats qui peuvent nous permettre d'avoir des données probantes que nous utilisons pour élaborer des directives communautaires, des règlements, des décisions, des protocoles et actes additionnels qui vont impacter la vie de plusieurs personnes. La décision que nous prenons sur la base des données probantes concerne la gouvernance économique et la convergence, la construction du marché commun et la réforme sectorielle. Ces données probantes sont essentiellement analysées par la conférence des chefs d'État et de gouvernement, le conseil des ministres statutaires, la commission elle-même et le comité des experts statutaires. Alors, donc rapidement, pour conclure, en termes de perspectives, la commission est en demande de partenariat avec des acteurs comme 3IE, comme WASI, comme le Centre CLIER francophone, et éventuellement avec AEN, pour donc produire des données probantes qui pourront nous aider à éclairer la prise de décision et l'orientation qu'on doit donner à nos politiques et nos programmes communautaires. Je vous remercie.
Thank you very much. Very, very interesting perspective from West Africa. Deo started out talking about some economic concepts and borrowing those ideas and bringing them to the market for evidence, if you will. The importance of demand and supply. And as a relative startup, the importance of getting those initial clients, the importance of advertising, and the importance of following up with them to make sure they were satisfied with your service. Today at lunch, 3 different people asked me if I was happy with my lunch. Service providers follow up to see how their product is being reserved. And if we could maybe push the metaphor a little more, Deo talked about that this isn't going to happen in a flash. So we do need patient capital from our funders as evidence entrepreneurs. And you could see from the experience of Uganda, what happens when you have a mature business model. You see how well that experience worked that Timothy talked about with us. And I'm really pushing it a bit now farther, but Mr. Clement was talking about not only the partnership with capacity building, but also the importance of having evaluation demands put on governments. In other words, what we have there is the state acting, if you will, to complement the market and to help us get a more efficient market functioning. We have a very interesting picture emerging as we go to South Africa. And so, Laurent, what can you tell us about the experience you have had with government? And then let's definitely hear from the perspective of government.
Thanks. Well, first checking, hopefully you were happy with your lunch, right? Cool. Welcome to the South African corner. So Harsha and I have been on a journey together for the last 7 years, trying to get rapid and responsive evidence service off the ground between national policy departments and different forms of producers of evidence, NGOs, researchers, etc. And I want to share a little bit of that journey with you now. So it's been 7 years. I think as any journey, there have been up and downs, there have been dead ends, there have been U-turns, but it's been a beautiful journey all in all. And I think it's a nice opportunity to look back and where are we after 7 years. And so we have covered 7 different national policy areas in those 7 years, and the responses took on very different formats in each of them. So it's quite interesting that I think we're still quite far away from a standard model that we can just plug and take into a new policy area when it comes to responsive evidence services. And so we have different trajectories, different pathways, and it really differed in each of the 7 policy areas. But one thing that we had in common throughout each and every response and each and every policy area was that we have co-produced. So we've co-produced together right from the start a co-production approach that was led by government, by the users of evidence, so it wasn't initiated by researchers. And I think that has informed the way we've been working together for the last 7 years, and it's probably one of the core values. And I guess for me personally, one thing that has made this journey so beautiful. But maybe we can start at the beginning. So this journey started when I was on leave, and I suddenly got an email in capital letters, urgent, from Harsha, and I had to be very responsive, very quickly. So what happened there, Harsha?
Thanks, Lawrence. So, doing that urgent, obviously with exclamation, like you need to read this immediately, was just me relaying a message and not me. So, where it comes from. But that was one of many policy moments, I would say. And if you didn't respond, Lawrence, what would have happened? There would have been no relationship today, right? So I think, everybody has been mentioning how important relationships were. And it was one of those moments where you were hoping that you're actually looking to somebody who can respond in a moment of need, and in a moment of need that was well defined. But it was our struggle to actually secure researchers that would be able to respond to this need. So that's when the journey started. And I think when colleagues spoke from Uganda, it was almost like you already describing a context that is very similar, it's very known, right? So if I can just fast forward, post now 7 maps and policy areas that we did work through, we are not working in one sector. So it's not just health, it's not just education, it's not just environment or economics. We are servicing a whole lot of different needs, different requests that straddle all across these sectors. So how do you build an effective service that is now changing lanes constantly like this, right? As well as, I think everyone in this room understands the politics behind it. That is an unstable environment. It's somewhere where how do you build for the health sector? Is it going to look different for the education sector? Is it going to look different for the environment sector? Noting that we're also dealing with different stakeholders within that grouping. So if you have the health sectors, you know that there's different professors, there's different experts, but then the education has their own, environment has their own. Now, that was the context within which we were working. So co-production was, somebody mentioned from the AEN family, it's in our genes now. We have encoded it into our genes. And this is our approach, our process that we follow. And there's a whole write-up on it. But I think that for ourselves, if you see that, do you want to define us as a service rendering, or are we responsive? Is our responsiveness in providing that service? So we were trying to work that out, and I think over the years, from one policy area to another one, we found ourselves building something. So what is it that we were building? Maybe there's a different face that you see on the outside, but there was something we were building. And at the bottom of, so if you talk about a foundational way, there was some level of research infrastructure that we didn't have, that the evidence community has, right? Now, I'm not saying go out and, have a library service, but there was essentially a lot of requests coming just for where can I find it? And I think all the colleagues were mentioning that. So can we not just have and equip these policymakers with a search facility? And that's what we brought in. So on a very, doable way, instead of outsourcing a project and financing that, let us bring in the software that will enable them to do their own searching outside of Google. So we started to build this infrastructure, but part of that infrastructure, of research infrastructure within the policy space, we also realized that it's the stakeholders, right? And it's all these differences in these relationships. So we had to keep tabs of who is doing what and in what space and informing what. So it was this multiple sources of information that we had to make sense of, which is when mapping was the most appropriate way that we could build knowledge resources that was meant to be used within the public sector. And that's why mapping is not just a map, move on to the next project, another map, move on to the next project. It really is a gold mine of information, like the one from developmental state. We're actually using that knowledge resources till today, which was the second map that we did, right, Lawrence? And took on a very different role, not just evidence of effectiveness, but theoretical evidence. I struggle to know how a responsive service can be done without this infrastructure, without this access to this infrastructure. Some of it we've built in-house, but that was the request, that was the urgent, please help us. So I'm happy to say that on a very personal level, there was this vulnerability that we had to know what we don't know and what we can't do. So there's this codependency. We are 4 people in our unit. So there's no way we can work on our own. And I think this on a personal level was to say, we need you, and this is what we need you for. So we were actually trained by the best. 3IE came in, Berto was the first one. We flew over and said, teach us this mapping. She taught us the mapping. ECRIS was the second level of training we asked for, because they have done rapid responses. This 28-day one, it's a holiday for us. We have like, can you give it to us tomorrow? And when you want us a request by tomorrow, where do you draw it out from, right? So I think in terms of responsiveness, it's the secret of keeping your policymakers engaged. Don't say, let me negotiate. Yes, we are negotiating the time frame, but it's the quality that you don't want to compromise on. So we keep them engaged. By keeping them engaged, we are asking what the brief is. And when we reflect the brief back to them, they realize, I wasn't very good at asking the question well enough. So we keep doing this until we define what it is that they need. So I was asked to write this up because it really isn't. So there's this write-up for the past 10 years of what we've been doing. And it is on our website, so I cannot do it in 10 minutes, but that is it, yeah. But Lawrence, sorry, Chair, I just want to pose a question. Because a lot of challenges get posed about the demand space, right? There's all these political challenges. There's this, this unstructured environment that researchers are not familiar with. Can I pose this back to you? What are the challenges on the supply side? Can you share that with us?
I think it's a really important talking point to just bring up, right? So it sounds all great and it sounds rosy, like 7 years, 7 policy areas, but behind the scenes, it was really hard work. And oftentimes we talk about the demand space as unorganized, unstructured. They only give us 24 hours. This is so unfair. Why don't they know in advance what questions they have? We're not much better on the supply side. Like, very honestly, when we're based at university, nobody in the university cared about the rapid responses. The dean, they cared about academic incentives of journal articles. Whether or not Promise and Andile, you've probably seen a lot, ran around and informed a national policy with data and evidence, that doesn't really count in the university system. There's no kudos for that. You should have published an article rather. So we really struggled on the supply side to educate and advocate in our own community why this is important. And I will not go into the practicalities of it, but trying to manage a responsiveness grant where you can't really say what meeting is for what purpose is also a beauty in a university system. And so it's an interesting talking point, but ending on a more positive note, really echoing that only together were we able to pull this service off. And thanks to ACRIS and thanks to 3IE, because without you having co-production in your DNA as well, there wouldn't be our service today.
Just on a lighter note, I do note that I'm the only woman on this panel with the chair, and I hope that's not a message to say policy making is a man's world, right? So we're not saying that, definitely not saying that.
I was really struck with Lauren's first comment that the email he got from you said urgent in all caps with 3 exclamation points. And now I'm all the more struck by it. I really, really liked your summary that ended with the engagement with the policymakers of reflecting back to them what question they're asking and helping sharpen that. From my mind, as having been on the research side, it's so, so important. And also having been in the policymaker's seat, also incredibly important to have that engagement and that thought partnership. I also really liked the point you made about the willingness to identify what you don't know and to be able to build on that then. And this point, finally, about incentives that Laurent made, I think is extremely important, that the researchers face different incentives than those of us who have to respond and provide evidence. Okay, excellent panel. I want to thank all of you, and now give our colleagues in the room an opportunity to ask questions. We started a bit late, so we do have time to run over, as long as you all have questions and are interested. So perhaps if we could start first with questions in the room, and then after that, we'll go to questions online. Okay, do we have a microphone available? Okay, I think first we had here in the middle aisle, halfway down there. Yes, the woman has her hand raised, and then all the way back, and then around 2 stops in the back here, and in the back with the gentleman on the your far left.
Thank you to the presenters. I came a little bit late, so I think I caught the last 2 presentations. My name is Violet Murunga. I work for the African Institute for Development Policy, AFIDEP in short. I'm going to take it from the tail end because at AFIDEP, I do some work on evidence synthesis and translation. And being a transferable skill where you can go from to different, use the same approach in different sectors, I find it challenging when I'm working in a sector that I'm not an issue expert, and it would be really helpful to understand how how you manage that. So I have an expertise in adolescent sexual and reproductive health, but currently I'm also supporting a project that is focusing on advancing domestic health financing in Africa. And it has surprisingly complex concepts and frameworks within it that I have to, so there's a learning curve, and then you're doing that in the context of timelines to meet decision makers' needs, timelines to meet the funder time requirements. So it's really challenging, and I would really like to understand and hear how you all, address those challenges in your work.
Okay, excellent question. And now we could go to the gentleman in the far back.
Thank you, our panelists. I have a question for the commissioner from OPM. The government has institutions that are in charge of doing research, and for example, EPRC, and then UBOS. I would like to inquire from you, do these, and of course you also use private institutions to do research, are these institutions aware of the evidence inclusion into research to do decision making? And if not, what can be done? Because all the researchers literally in Uganda do their research based on the UBOS data. So I would like to know, is there anything you're doing about that to make sure that all the institutions are aware of the evidence part? Thank you.
Okay, thank you. And then the far back in the right corner. We'll take one more, sir. And then.
Thank you to the panelists. My first point is actually for Lawrence. I think, Lawrence, you made a mistake of telling us how to make sure whenever we send you an email, we receive a response within 2 hours if we put urgent and 3 exclamation marks. So just remember it. No, I'm kidding. Lawrence is super responsive always. Actually, my question is for Arsha, and Mr. Clément. I can translate after, but my question is about one challenge that we face sometimes is on what is the best format or layout to present the findings of our work very often. We often face cases where we are very happy with our super detailed reports with a lot of very interesting things inside, and when we present it, that's too much. That's too complex, too much details. So I would be interested about your perspective on what is the best format. En traduisant pour Monsieur Clément, ma question portait sur quel est le format le plus intéressant pour vous lorsque vous recevez des travaux sur les données probantes. Parce que c'est vrai qu'une problématique à laquelle on fait face parfois en tant que chargé de recherche, c'est produire de la recherche est une chose, mais parfois le niveau de détail ou le format qui est proposé n'est pas toujours le plus idéal pour les gens en charge de la prise de décision. Donc, intéressé d'entendre vos perspectives sur l'idée du format. Voilà, merci beaucoup. Thank you.
Okay, thank you. Let's take one more up here, and then we'll turn to the panel.
Thank you so much, Chair. One observation, we didn't understand the French presentation. That's just one observation. But my question is to Akers. If I give you $1 million today, what would you do different in getting this evidence going out?
Okay. Excellent set of questions. I wonder if we might start with Acre or Uganda, in both of our colleagues, with both the first question and the last question. So the first question was about complex frameworks in a different sector and time pressure. The last question is if you get $1 million. And then perhaps we could turn to Mr. Clement and Dio, the questions about format, layout, and also whether there's awareness of institutional requirements. And then perhaps turn to Harsha on the same question on format and layout. So.
All right, James, first, do you have $1 million? We could start from there and then have a private conversation about what we can do about it. But there's definitely need for it in the kind of work that we do. As you've learned, as everyone has talked about, these relationships, first and foremost, need to be sustainable. I think when we say that, it just seems sort of a passing remark that it has to be sustainable. But I can imagine if at one time in the 7 years, Lawrence was working with Harsha, and he got probably about 3 years, and he was like, you know what, funding is done, so this is it. We have been fortunate. We've been around for over 10 years. And so you have to be available. Otherwise, the moment that you're not, then policymakers are either going to revert to what they were doing, or probably you hope after some time they may pick up. But that's a very long stretch. And like I've said, we've been around for quite some time. The other part that I would want to mention is that as I'm talking right now, I'm sure a few years back, Lawrence probably, not probably Lawrence knows this, it was Rona. And she was moving all over the world talking about the rapid response. Of course, she studied it. She's, as Lawrence puts it, do you say the godmother or something? Yeah. So now I'm the one talking. So there has to be the transition in the leadership. So you have to be aware of that. In the morning, my colleague Edward Kayongo was the one talking. That shows that there is growth. It's not just about one person, because when that person is away, then what then happens, if I'm talking about the rapid response service and I'm saying when a question comes in, all hands on deck, who is the whole hands? If you're just seeing one person talking, so that's very important. Then the question about if a question comes from a topic that you are not comfortable with, what do you then do? I think on Tuesday, we was having a chat with Ruth in the group, and we were introducing ourselves. I mean, I've known Ruth, I think, at least for about a few years now, a few more years, probably more than 3 years now. And I mentioned that my background is medicine and epidemiology, and everyone seemed surprised. And they were wondering, how did we not know that? I mean, I get to the room and I'm talking about education. And at one point, I'm dealing with questions from a development economist. I'm a medical doctor with a background in clinical epidemiology. What I prize myself in is having the skills, the process skills, being able to find the evidence. But also within that is, Harsha mentioned from the policymaker side, the vulnerability of knowing that you're not the expert in each and every topic. So we will always co-opt on someone, content expert, to help us understand these frameworks, understand the language of the issue that you're dealing with, so that it makes it easier for you to then now synthesize the evidence that you are talking about. But definitely finding it and putting it together, that I can do and probably talk about it for that period of time. Thank you.
Timothy, anything to add?
Okay, thank you. No, I have just one question actually, direct to me, and I will be very brief to it. The question was that do the research institutions in government or established by government understand the concept of evidence in doing their research? That's really the question. And my answer is a big yes. A big yes, because actually the Economic Policy Research Center that you referred to, EPRC, by its nature, it's meant or established to undertake research, to advise government on economic policy. So by its nature, it's very, very evidence-based. If it is recommending some policy change on monetary policy by the central bank, what is the basis of its recommendation of that policy change? The Economic Policy Center, as you understand, is under the Ministry of Finance and is very much related to the macroeconomic department and the central bank. So it's actually established with that understanding that it will be largely evidence-based. But also the personalities there. There are some in this conference. I saw Elizabeth in this session. Actually, maybe she has stepped out. And several other personalities there. Dr. Madina, I think, was also around. They are one of the strongest evidence-based promoters and advocates in this country. So the answer is yes. And the same with the Bureau of Statistics. The Bureau of Statistics annually, at the beginning of the financial year now, like now, they do contact every government ministry and ask, what are the areas where you need us to collect data through national censuses so that they can be useful for your planning and program work in the subsequent years. So again, by their strategic plan, they are supposed to be evidence-based. So if they understand, the answer is yes. And the only other short comment I want to make is that to my sister, your dilemma of working in a field where you don't have, where you would imagine you don't have the competences is not only limited to you. Let me give you my quick short experience. There is something called International Health Regulations, signed in 2005, and it is about, it's by WHO and all the countries that are members, I think, of the UN. And it's about countries being prepared to deal with the health hazards and health risks. Now, right now, there is a global evaluation. It's called JEE, Joint External Evaluation of the International Health Regulations, and we have it in every country. Now, for me, my background is economics, but because I am heading the National Office for Evaluations, I am heading the joint evaluation for the International Health Regulations in Uganda. I can assure you the amount of health terminology that is contained in that evaluation gave me so much headache in the initial years that I actually faced the same challenge that you have faced. But it is actually an exciting experience. Thank you very much.
Excellent, thank you. Okay, let's move now to West Africa. We had a couple of questions, one about format and layout of making evidence useful, and the other one was about awareness. Mr. Clement?
Thank you. Well, regarding format, I think we have the classic one, being paper-based, emails, organized workshop. But what I think we're not doing enough and we should be doing is to take advantage of the digital transformation the world is going through. We have designers who are really good at preparing these quite affordable apps that we can use to promote accessibility to evidence in real time. Decision makers do not need to be in their office for evidence to be available to them. We should find a way to bring evidence to them in their cars, right after a conference, at a coffee break, and so on and so forth. And the classic formats, while they're not really bad or wrong, cannot reach those moments, while those moments are critical for decision makers. So essentially, that's what I would say. We need to do more with respect to digital solutions in our field of evidence-informed decision making. Regarding awareness, yes, we need to continue to be persistent in whatever we're doing in our different capacities and collaboration. There are things that 3IA has been doing for ages now, and at some point we thought it's important to partner with other organizations so that the experience of not having, actors, not having the same persons coming over and over again helps also. Having new ideas, new people talking about the same topic could influence how policymakers, decision makers react to the song that we've been singing for the past decades. Thank you.
Thank you, colleagues. I think that question about working in different sectors without expertise actually takes me back on my own journey, because we are now a unit within the policy making, and I think colleagues, Chris mentioned proximity. So proximity is important, but I think for myself, on a personal level, I did get looks, I would say an attitude that you're not the expert in the field, but we never claimed to be the experts either. So we have a very deliberate strategy, one of 5 strategies in the co-production model, which is matchmaking, and we abide by that. So what I mean is that you will have your methods people, and we spoke about methods here, right? So we want quality, we want assurance that we're using our methodologies in the right way. But we match that between government and the research community. Then we will match the experts, the sector experts, the content experts, between those out there who are the professors and the experts in the field with government officials who are also experts in the field. Then we have, specific other levels. So when we were busy doing the mapping, there was the digital and the business intelligence language that we didn't know, but we had to match them to the IT professionals in government as well. So there was a very deliberate process. In fact, even information searching, it's people like from ECRIS and even from WASHI, from the impact evaluations, we learn from the best, right? So that we bring it into that field. But what does it mean for our role? So this is the part that became clearer for me, that we were literally playing this brokering role. No one defined it. No one told you this was your job to do. We were just busy doing it. And that is partly how we've actually survived. And this is a survival strategy, to be able to not be experts in every field. You'll never be an expert in every field. So this part of managing a process became so critical. In terms of the second question that was posed to us, in terms of what we know when we do procurement and commissioned work, our evaluations unit has specifically put it into the terms of reference for the format that we want it in, 1-5-25. And I think this is what we learned from our 3IE colleagues as well. 1-5-25. 1, give us a policy summary, 5 pages of an executive summary. Then you get 25 and maybe 60 pages of a very, very detailed report. But those are general reports. Those are general reports. What we did have is this negotiation period when we do with the briefing with who are we being responsive to? Are our clients, in-house clients. And then we say, okay, if you want a quick search, then we'll do a briefing on the evidence. So we're not analyzing, we're not doing anything, it's an evidence brief. If you want a policy brief, we will convene the necessary stakeholders and we will do the policy brief. If you want a rapid evidence synthesis, we'll do that, which is what we did as well. So this is the kind of product negotiation that we do given the time frame and making sure that it's quality assured. So there's a range of them, and we're happy to talk with you afterwards. Thanks. I don't know if Lawrence wants to add anything.
Just a quick point. I think I would completely agree with Dio that, you know, in a sense, we have these digital technologies now, and for all of us as providers of rapid response services, there's an elephant on our phones, and that's ChatGPT. So why would Harsha and other colleagues go to us, who still need at least a day, to answer a question that ChatGPT can beautifully answer within seconds? And there's all sorts of quality issues, but essentially, that's our new competition, in my opinion, as providers of rapid response services. And so I fully agree there with Dio that we need to bring these digital technologies into our space and make use of them.
Really, really good comment. If you can bear with us 5 minutes, do we have anyone checking for questions online? I think our online colleagues have gone to their happy hour in their dispersed locations. Okay, if we don't have any more questions, then I really want to thank, we have one more in back. Oh goodness, two more in back. Okay, 2 quick questions, then we'll do 2 quick lightning responses lightning responses up front.
Okay, thank you very much to the panelists. My name is Anne Okello. I work with Afrobarometer and I am based in Nairobi, Kenya. Mine is more of a reflection and not really a question because I have actually enjoyed the panel where we have people from both the supply and demand for evidence. So it's just something that has been piquing my interest from the data that we generate as Afrobarometer. We find that most Africans have high trust in informal institutions. These are traditional leaders and religious leaders, and actually trust in formal institutions like the police is at an all-time low, but with the government, the high court, the courts, and also legislature, trust in formal institutions across the continent is quite low. To give an example, like where I'm from, Kenyans have high trust in religious leaders, and second is the military. In Uganda, where we are now, Ugandans have high trust in religious leaders first, secondly it's the traditional leaders, and third is the president. But like other countries like Sao Tome and Principe, Zimbabwe, Tanzania, trust in informal institutions, which is the religious leaders, is very high. South Africa is quite interesting because South Africans have high trust in the media, independent media, and also government media sources. And to West Africa, I just ran the data quickly on Ghana, which is quite interesting. Ghanaians have high trust in the military, but religious leaders come second. So just a quick example of how our partner here, our local partner in Uganda, is trying to work with this. Is we are really trying, I don't mean that we have to go to the churches and look for the imams and speak to them, but when you look closer, you find that these religious spaces are institutionalized. Like in Uganda, we are currently working with the Interreligious Council of Uganda, and we signed an MOU with them, and we are trying to disseminate our findings in the most easiest possible way. Because as the session before this with Evelyn, what she said was that, you know, Africa is all about informality. You might be trying to influence policy in a government space, but you go and approach the government leader and they say, oh, let me just make this call to whoever. So that's what we're trying to do. And even to build these relationships, even with like people in the donor community. I remember we presented these findings to, it was a technical working group on democracy. So we had various donor groups. And when we say that people in this country really trust the religious leaders, the first question they said was, but are the churches democratic? But again, they called us once again because they were trying to find a way of how to penetrate, because you find that in our governments and these other high spaces, people do make informal calls, and this we can try to penetrate this through these informal institutions. This is just a reflection. Thank you.
Really interesting. And just before you lose the microphone, could you tell us again your institution, where you're from?
Okay, I work for Afrobarometer. That's a Pan-African Research Institute that has been in operation since 1999.
Yeah, thank you.
Hi, everyone. Nice to have a good panel. I just want to make a challenge to my colleague, the Harsha. I know we're government, we should be talking on the sidelines. I want to challenge you, Harsha, in terms of, you spoke about the proximity. And I also think your department has a close proximity to the highest office within the country. Can you push for the institutionalization of evidence in other departments? We've been trying, but there's a little bit of a pushback from certain departments. We can learn from what you guys have done. Obviously, you'll work with Lawrence in terms of conceptualizing that particular process on how to do it. This emanates from also the National Treasury in 2022, if not 2021, where they published a report on moving away from capacity development towards capability development. So I think what you have done within DPME is the actual implementation of the capability development, because after you are gone, whether you go to academia or what, the institution itself and what you have implemented there will still remain, and DPME will still thrive. So your proximity, please use your proximity in terms of pushing agenda so that it can be implemented within other departments. Thanks.
Okay, thank you. And I think we had one more question in the far back there, and then we'll do a quick round of responses.
Thank you, panelists, for your diverse views. Mine is about the approaches. I would love to so much relate with the first presentation we had from Adeline. She said something about the approaches we use to collect this evidence. One of the examples she gave is that if I randomly asked someone how much they earn, it's so likely I will not get the correct figure. So to our representatives from the government, what are the efforts to make sure that we get the correct evidence using approaches that speak to our African people? And are there any structures to make sure that the people we collect evidence from buy in? Thank you.
I said quick, but then we got a very deep, profound question at the end. So do your best to be brief. It's an important question and a profound one. Mr. Clement first wanted to add a bit to the question on format. And then perhaps we could go to Harsha, and then anybody who's game can take up that last question.
Okay, thank you. Alors, sur la question de format, ça dépend de l'instance de prise de décision. En règle générale, la décision au plus haut niveau est prise par la conférence des chefs d'État et de gouvernement, qui est l'instance décisionnelle suprême de la commission. Et donc, à ce niveau, le format, ce sont vraiment des synthèses. Synthèses brèves qui sont faites à la conférence des chefs d'État et de gouvernement pour prise de décision. Mais nous sommes également intéressés par des études détaillées au niveau du Conseil des ministres et au niveau des experts statutaires. Mais l'instance la plus représentative pour la prise de décision, c'est vraiment la conférence des chefs d'État et de gouvernement. Et à ce niveau, ce sont des synthèses dont nous avons besoin. Donc voilà ce que je pourrais donner comme réponse à ce point. Merci.
Okay, thank you. Harsha.
Thank you so much. Gosh, I thought everybody will be nice and calm and peaceful and maybe sleepy after a very nice lunch, but these are difficult questions, but very nice questions. The colleague with trust, it's such a big issue. So I would love to talk to you afterwards because we've done a similar one with trust in the South African government. I think, Luvuyo, for pushing institutionalization, there was a whole session that Marie and yesterday on institutionalization, right? And I want to say, if you think that we must enter a space to start institutionalizing, it's probably the wrong way around to look at it. If we see that policy processes are already underway, it's happening, there's the executive arm of the state, there's the legislative, there's the judiciary, there's an organized macro structure. And in that way, we have entered that space through the socioeconomic impact assessment system, where every government department, whoever is undertaking a policy review, has to go through a SEAS process. Every cabinet member knows that. And when that comes into, it's already in place, right? So you're not going to have a tariff shift or a new policy direction or a review of a current policy approved if it doesn't go through a SEAS. And what does that mean for us as the evidence community? It means that the first part of a SEAS is to bring out the evidence by every government department. And not just evidence, as to what the options are. We're going to do this, we're going to do that, or we're not going to do anything else. What's the evidence? So it's heavily evidence informed, and that's what the departments are actually struggling about, which is why we need to be the responsive that we were talking about, right? So it's there, it's in the making, it's catching on, it's a little bit like 3 years in the making in terms of being responsive from an evidence perspective. I think the part of the last question, approaches to collect the evidence. Now, we spoke about scientific ways. Now, I think I will draw from what we do in South Africa, and one of the prime ways that we looked at, especially in high politics kind of areas, like land reform, there was public hearings happening where a little bit close to the way Truth and Reconciliation happened. Public hearings are where citizens come to discuss openly in a public domain their experience of these policy processes. There's recordings of it. And then government reports will be this compliance-driven exercise of regular reporting. So what we do in our department is to triangulate. And we triangulate what is, it's a very well-known rigorous methodology to be able to say, this source is saying that source is saying that, the media is saying this, who is right? But this opens up another can of worms, right? So these are very deep questions, and I'd love to talk more as well. Thanks.
Yeah, it's an excellent opportunity for a follow-up panel. Does anyone else, though, want to talk briefly about the can of worms challenge? Ishmael, Theo, Laurent?
Yeah, I think that refers right to the question of how do we get gender and equity properly integrated in the whole process of evidence-informed decision-making. And so I chicken out a little bit by saying, I think you're asking the right question, but it's incomplete. So it's not just the research production where we need to bring these issues in. We need to do the same in the evidence translation process and the same in the evidence use process. So we're facing that issue not just in the production of evidence, but also in its translation and use. And if we only fix it in one part of the system, we still have it in the other two parts. And my colleague, Andile Badonsela, our gender and equity lead, she had a panel on this this afternoon. So maybe that's another chance for a conversation.
Okay, thank you all very much. I hope you all join me in thanking our colleagues here. We talked a lot about the challenge to do what they're doing, to accomplish what they're doing. But the fact remains they're doing it. I mean, in my mind, this is extraordinary. This is where the gears mesh when research and policy making come together, and that's how we get movement. So perhaps we could end the day with a round of applause for our colleagues here. Thank you.